And now, I would now like to invite our WHO Regional Director of Europe, Dr. Hans Kluge, to take the floor, to speak to us on the theme of reimagining WHO Europe for the future and going back to the basics, the theme of this year's RC. Dr. Kluge, dear Hans, the floor is yours.
Thank you very much, Madam President, Minister Martin Dupré from Luxembourg, dear Chair and Vice Chair of the Standing Committee, Dr. Thomas Denser, Ms. Asta Valdimarsdottir, Ministers, colleagues and friends. What a pleasure to welcome you to the first Region Committee of the second mandate that you entrusted me last year. Thank you so much for your trust. I very much look forward working with you to improve health and leave no one behind in all 53 member states. And a special thanks to you, Minister Sophie Leude from Denmark, for personally welcoming us in the beautiful city of Copenhagen. Mange tak. Dear Ministers, colleagues, once again, we gather in times of crisis. The devastating war in Ukraine continues. Budgets are tight, health workers are few. We rejoice in the hope of peace in the Middle East, but the crisis has devastated the hostages and their families in Israel, but also health workers, civilians, and the most vulnerable in Gaza. WHO itself has faced the devastating consequences of the US withdrawal. But crisis also teaches us. The COVID-19 taught us to act fast in emergencies, while at the same time to keep the core public health programs alive. We called it the dual-track approach. And the crisis also taught us the need for a new business model for WHO Europe. More agile, efficient, impactful. My motto became different with less. That's why today I speak to you about reimagining the WHO Europe of the future. And actually, this is guided by all of you through the very inclusive consultation process developing the European Programme of Work 2026-2030, EPW2. The single aim of my speech today is to reassure you, member states, my governors, that we are implementing a solid plan for WHO Euro of the future, which is stronger, healthier, trusted, delivering the highest standard of evidence-based, politically neutral services, with 20% less of the resources, leaving no one behind. And to pull this off, we're implementing 3 interconnected streams of work in line with the UN 80 initiative championed by the UN Secretary General to make the UN fit for purpose at the occasion of the 80th anniversary of the United Nations. Number 1, back to the core mandate. Number 2, efficiency and accountability. Number 3, restructuring and alignment. Let's start with the core mandate. The WHO Constitution defines our purpose, the attainment by all peoples of the highest possible level of health. Health being a state of complete well-being and a fundamental human right. And in order to keep that fundamental human right, as Dr. Tedros often reminds us, the most critical medicine we need nowadays is peace. Without peace, there is no health. And today, we will hear that call for peace directly from Roman and Sasha, 2 young children from Ukraine. Roman was grievously burned during the war over his whole body, including his intestine, miraculously survived thanks to medical evacuation facilitated by WHO Europe, and Sasha, a young girl who lost her leg when a missile hit her home. Let's listen to Roman and Sasha.
Про що ти мрієш прямо зараз? Я хочу, щоб ніхто не хворів.
Щоб не було війни.
Я мрію стати олімпійською чемпіонкою.
Я хочу бути конструктором, і я хочу сконструювати свою машину.
А якби ти міг щось змінити в цьому світі, то що би ти змінив?
Я би зробив так, щоб був мир в Україні.
Thank you very much, Roman and Sasha. Дякую. Dear Deputy Minister Gonchar, please rest assured that we keep our word of last year that this regional office will continue to work relentlessly for the health of the Ukrainian people. Dear colleagues, through the EPW2 consultation process, you identified 5 key roles, 5 core functions for this WHO regional office for Europe in line with our core mandate. Let's highlight them one by one. Number 1, you ask us to be the regional knowledge hub for health. And here I would like to point out the primary healthcare, all the knowledge. Actually, recently, at the sidelines of the UN General Assembly, the government of Kazakhstan, together with our Center of Excellence in Almaty, pulled off a major event on primary healthcare with more than 400 global health leaders, reminding that primary healthcare is the basis of universal health coverage and the sustainable development goals. And I would like to thank the Minister of Health of Kazakhstan, Dr. Akmaral Sharbalevne Alnazarova, for the great leadership of her president, Kasim Jomart Tokayev, to the global coalition on primary healthcare, which Dr. Tedros and me very strongly support. And here definitely I would like to commend the Minister of Health of Georgia, Dr. Mikhail Sargeladze, implementing historical primary healthcare reforms, moving from action and strategy to real results. Congratulations. Another example is the launch of the health system performance profiles of 15 non-European Union countries, which we did together with the European Observatory in Belgrade in Serbia, with the leadership of my good friend, Minister Zlatibor Lončar. Hvala vam pula, dear friend. And the other example is the launch of the NCD quick buys, 25 proven cost-effective interventions which deliver impact within one political cycle, between 1 and 5 years. And here we have many champions. First, I need to commend Minister Martin Depré for a major event at the Permanent Mission of Luxembourg in New York the day before the UN high-level meeting, where we relaunched the NCD quick buys. Thank you very much. And I'm present also for the amazing hospitality. Dr. Carmen Joller from Estonia, I would like to congratulate you with your brave leadership to push down the alcohol consumption despite of the heavy industry interference. Quite a tour de force. Minister of Health, Helena Mas from Andorra, thank you for joining us. I remember how you have been always a champion for screening of breast cancer, a very important NCD quick buy, and I understand now combining with biannual colorectal cancer early detection. Congratulations. The Minister of Health, Dr. Erkin Maratovich Chechimbayev, is actually right now on his way to join us from the airport. So please tell him what I'm going to tell. He is amazing to develop the national NCD plan in no time. We just had a very senior mission through a whole of government approach, linking primary healthcare with public health and also involving the subnational level. I remember Dr. Ergin Maratovich was telling in New York how sporty his president is. I know, we are playing football in Bishkek, and that the president, Sadi Japarov, is organizing each year a football tournament between the ministries, and Erkin Maratovich was very proud to say that each year the Minister of Health is winning the tournament. Second key role, to be the impartial coordinator for health. My dear friends, you remember that I made another promise to you last year that this office would not rest before we reach the milestone of 1,000 heavily wounded, heavily sick children from Gaza to be evacuated to European countries. 3 days ago, we reached that milestone. And from the bottom of my heart, I want to thank all those 17 countries which stepped forward. My brother, Dr. Aziz from Turkey, no country has been doing so much for that. Teşekkür ederim. But, my friends, WHO estimates that as of today, 3,000 children urgently need specialized treatment outside of Gaza. Remember, the Quran, the Bible, the Talmud, they all say the same. If you save one child, you have saved humanity. I appeal to all countries. Why 17? We have 53 countries. For every country at least to evacuate one child. 53 times we can save humanity. At the same time, I always have been non-stop advocating for the unconditional immediate release of the Israeli hostages and to morally support their families. And rest assured, Director General, dear Dr. Moshe Bar Simon Tov, that we will continue to stand with the families in this very complex healing process through the mental health program I established with the First Lady, Madame Michal Herzog. Impartial also means to be independent from commercial interests. While this House is not shy to build principled, transparent partnerships with the industry when and where it makes sense, like, for example, with the European Federation of Pharmaceutical Industries and Associations on the Novel Medicines platform to work towards sustainable, equitable access of innovative medicines. Third key role, to work on cross-border health threats. In Montenegro, with support of our country office and the FCTC, the finance ministers of the Western Balkan acted to curb illicit tobacco trade. And the Minister of Health, congratulations for great leadership, which will continue to need, dear Minister Vyacheslav Simon. HIV/AIDS and multi-drug resistant tuberculosis also remain serious regional cross-border health threats. And I want to acknowledge the efforts by Dr. Olegovich Salagai for having convened the high-level working group on HIV/AIDS in my presence to discuss the results of the joint review of the National AIDS Program to accelerate prevention and control, including to decrease stigma and discrimination among people living in so-called non-traditional partnerships. Next one, the fourth key role, health system transformation. In Moldova, we worked very closely together on the analysis of the health labor market through a gender lens, thereby strengthening nursing in primary healthcare under the great leadership of, now I have to say probably, former or outgoing Minister of Health, Dr. Anna Nemirenko. I know that Dr. Nemirenko was on her way to join us, but there's a change in leadership. Please convey my great admiration. What this minister has been pulling off in the last year is phenomenal, and we're very much looking forward to continue our collaboration with the new minister. Similarly, I would like to commend the Minister of Health of Bulgaria, my good friend Professor Sylvie Kirillov-Petrov, for your brave leadership to address the shortages in health professionals and to be such a strong advocate for the national nursing strategy up to 2030. Pozdravляем, Professor. If we speak about health system transformation, we continue to work through the sub-regional modus operandi. Remember, we started this 5 years ago, and it works quite well because we have such a diverse region. For example, in beautiful Bled, Slovenia, the Minister of Health, Valentina Rupel, convened the 12 small countries ministerial meeting, demonstrating that size is no barrier to impact. And thank you so much to the Minister for the great hospitality and for the great weather. I remember the first day I was running around this beautiful Bled Lake in beautiful sun, and the second day hiding for incredible thunderstorm and rain. So we got the whole palette. This month, I was myself in Tajikistan for a other very important sub-regional meeting, where my brother, the Minister Dr. Yamoluddin Abdullah Zoda, convened the 38th CIS Healthcare Council meeting around primary healthcare as a driver for health system transformation of the sub-region. Please, Professor Youssoufi, convey my great appreciation to my brother, Dr. Yamruddin Abdulozada. As we say in Tajik, Tashakuri Siyot. Tajikistan, Vapesh. Fifth key role, to be the voice for health equity. We cannot talk about equity without talking about mental health. Even yesterday we discussed with Minister Dr. Anahit Avanesian the major mental health transformation ongoing in your country. Congratulations, linking with communities, respect, rights and dignity for all. Actually, the Queen of Belgium, Queen Mathilde, was recently in Armenia and went to the mental health site and was very, very impressed. Congratulations. Equity, definitely, I would like to comment here the Minister of Health, Christophe Robino from Monaco, on the launch of the Handi Pact, quite a transformative national policy, working towards a society fully inclusive for people with disabilities, with the motto, nothing about us without us. Congratulations, Minister. And no doubt, equity remains very high, a brand of Magic Iceland. Congratulations, Minister Alma Muller. 95% hepatitis C cure rate among people injecting drugs and thereby eliminating hepatitis C in 3 years. This is really a tour de force. I would also like to showcase our UHC Watch. It's a very powerful health equity tool thanks to the support of the European Commission Universal Health Coverage. It's a evidence-based online monitoring in 46 member states which groups in your population are being pushed into poverty due to ill health, with a set of very pragmatic policy recommendations for each of the 46 countries, which actually many of you have acted. And here, definitely, I would like to highlight Minister Michaelis Damianos for a spectacular decrease in out-of-pocket payment once you introduce the new universal health system. Congratulations, Minister, and we are very much looking forward working together on successful EU presidency next year. Dear colleagues, these are the 5 key roles, the 5 core functions that you ask from us in line with our core mandate. And actually, they coincide very well with the mega trends that we put forth in the EPW2. Security, demography, digital governance, artificial intelligence, addressing distrust and climate change. On the latter, I'm very proud that we have among us Excellency Katrine Jakobsdottir, previous Prime Minister of Iceland, the chair of the Pan-European Commission on Climate Change and Health. I immediately established once that you elected me, and thank you, Katrine, for giving an update today at lunchtime to the heads of delegations. Actually, I myself, I was at the launch and the first hearing of the Commission in beautiful Reykjavik. I remember, Minister, you also had ordered a very exceptional sunny day at that time. And actually, I was thinking last week how symbolic it was. It was in Reykjavik. Some of you may have read in the global news that for first time in history, mosquitoes appeared in Iceland due to the very, very hot summer. Imagine. One of the stars that we had at the launch of the Commission was Miss Leila Aliyeva, Vice President of the Haydar Aliyev Foundation, who gave a brilliant report on the COP29. And I really have to thank you, my dear friend Minister, Dr. Timur Musai from Azerbaijan, because I remember it was your personal recommendation to me when we met in Baku. Great recommendation. Please tell Her Excellency that Dr. Rob is on his way in December to work out concrete action plan under your guidance. Thank you so much. And finally, if we talk about environment and climate, I want to highlight the efforts of the Minister of Health of Hungary, Peter Takacs, for the country's leadership as the chair of the Bureau of the parties of the Protocol on Water and Health. And I'm very much looking forward to joining in beautiful Budapest for November for the 7th meeting of the parties. Köszönöm szépen. Dear colleagues, this is how we are reimagining WHO Euro of the future by going back to the core mandate, to become stronger, healthier and trusted. evidence-based, trusted, politically neutral, with 20% fewer of the resources, leaving no one behind. But together, we're implementing a second stream of work in line with the UN 80, efficiency and accountability. It means more value for money without compromising quality nor impact at the country level. And we're doing this through 3 tracks. The first one is cost containment. I call it to stop the immediate bleeding. We know from experience that this approach works, because when I became the regional director 5 years ago, we faced a significant salary gap of $15 million, and we closed that gap by a combination of decisive measures, including relocating certain enabling functions to Istanbul. At the start of this year, since the withdrawal of the US, we faced a salary gap of $28.1 million. I would like to reassure you, my governors, that we are very well on track to close the gap by end of the year and start with a clean slate the 1st of January 2026 through a similar set of efficiency measures which you see on the screen, the global reserve, and attracting new funding. Immediately in January, we started to negotiate with our main donors to reprogram certain existing grants, which actually you heard from Commissioner Varhelyi, for the order of $3.5 million. And dear Paco, I would like to comment here and thank really my very good friend, Director General of DG Santé, Sandra Galina, for her amazing flexibility and leadership. Sandra immediately invited me to discuss for a breakfast, and actually, Paco, one of the most healthy breakfasts I had in my life. So please thank very much, grazie mille to Sandra. The second track under efficiency and accountability is targeted resource mobilization. The 21st of January, 12 hours after President Trump signed the executive order to withdraw from the WHO, I had the 10 main European donor countries plus the European Commission in the room here to brainstorm under the leadership of Germany on the foreseeable financial consequences and how to address them. Vielen Dank, Frau Ministerin Nina Warken, voor die starke ondersteuning.
Thank you.
Voor de WHO.
Thank you for the support of Germany for WHO and for our work.
Minister Warken here at a very successful World Health Summit, giving an amazing speech on the importance of the role of a strong WHO in the multilateral system. Dear Deputy Minister Dr. Kippels, please give my and Dr. Tedros greatest regards and appreciation to the Minister. I'm very much looking forward to our bilateral. Since then, the donor group met 3 times. The last time in presence of the world-famous Dr. Bruce Elbert to convene together the first ever member state briefing on the UN 80 and the global health architecture. Thank you so much, Bruce, and please come again. But here, I would like to thank all of you, also on behalf of the Director General, for your support in the increase of assessed contributions. Many times we tell you Dr. Tedros' situation would have been much worse without the increase in assessed contributions. But in particularly, from the bottom of my heart, I want to thank those European member states who systematically earmark a chunk of their global contributions to WHO Europe. Germany and Denmark are the champions here, and thank you again, Minister Löde, to your government for the very strong support to non-communicable diseases, which really remains very, very vital for us. My friends, I told it before, and I will tell it many times again. This is the time that Europe has to take care of Europe. Third track under efficient accountability, innovation and artificial intelligence. During my short summer break, I had 13 bilateral video conferences with those ministers of health in the European Union countries where we have a country office to ask them, right? I always listen to the member states. What's the value of the country office in those countries? All ministers guided me that we shall minimize the international footprint maximize national capacity, and together we agreed to host the WHO country offices within the Ministry of Health or national institutions. This is what I call different with less. On the artificial intelligence, remember Dr. Björn Eriksen, thanks to your initiative at one of the SCRCs, we gathered for 2 days in-house here, free of charge for us, the leading Nordic AI experts for 2 days of hackathon, to AI our internal processes and to come up with a costed roadmap. I participated myself throughout the 2 days because artificial intelligence is not about technology. It's all about leadership. We launched PERA. PERA is our in-house AI platform, which WHO is now replicating globally. And we're piloting artificial intelligence for learning, analytics, training, and real-time insights. Faster, cheaper, different. This is what I call different with less. And I want to thank the Minister of Health of Malta, Dr. Jo Etienne Abela. I know that Dr. Abela was on his way here, but was called back last moment, but please thank him for hosting a very important meeting, 18-19 November in Malta, the first WHO European meeting on artificial intelligence and health. Thank you so much, because I firmly believe that we as public health leaders at this turning point in history will be judged only against one metric. How did we leverage the unprecedented availability of technological and artificial intelligence innovation to improve health for all everywhere? Different with less. We also believe in the power of innovative collaboration with WHO collaborating centers and national institutes. Only a few days ago, I sealed a second deal. I'm also trying to get better in sealing deals. We sealed a deal with a friendly director of a National Public Health Institute to dedicate part-time of a senior expert to some of our flagship initiatives. I mean, just imagine that 10 more National Public Health Institutes would do this. This is different with less, the new business model. Throughout these hectic times, I tried hard to increase accountability and transparency. First and foremost, through briefings with you, the member states, the donor group, and of course, first and foremost, the Standing Committee of the Region Committee. I would like to thank the chair and the vice chair, but also you, Björn, and Rachel from Ireland as the chairs of the subgroups, and all SCRC members for a phenomenal support. Always nudging me and my great directors to go one step further, to be brave and to think out of the box. Without your support of the SCRC, I wouldn't have managed. So thank you very much. Similarly, since the beginning of the year, we kept open channels with the European Staff Association, in addition to regular town hall meetings, regular all-staff email messages, and the anonymous Ask Hans email box. But I do acknowledge that in times of uncertainty, communication is never enough. And that's why I really want to thank the president of the Staff Association, Anita Steffin, for the very tough but very respectful dialogues we keep. Thank you so much, Anita. This is, colleagues, how we are building the WHO Europe of the future, to be stronger, healthier and trusted, evidence-based, politically neutral, with 20% less of the resources, leaving no one behind. And together, we're implementing a third very important interconnected workstream in line with the UN 80 initiative championed by the UN Secretary General. Restructuring and alignment. This is not about blunt cutting. It is about a new business model, which I can summarize in 4 points. Number 1, Copenhagen remains the normative powerhouse. No doubt about that one. Istanbul leads on enabling functions. Almaty Primary Healthcare Center incorporates TB HIV and some functions of integrated NCD management. And for the country office shift from being reactive to anticipatory, from being running around to implement to being advisors to the Ministry of Health. We reduce the staff with 20% while proudly protecting young talent. But my friends, this is a very, very painful process. Each morning, if I arrive with my bike and enter the building, I do feel the pain. Because these reductions are not just numbers. They represent valued colleagues and their families that for now we have to say goodbye. And I stand in awe for their remarkable resilience and determination during these exceptionally difficult times. And you could do me no greater pleasure than give them a resounding applause. Thank you. Thank you very much. That means a lot. These staff cuts represent $50 million, and the relocations will save another $8.1 million. With this, the staffing in the WHO Regional Office for Europe comes back to the pre-COVID levels, with one exception. Remember, I always keep my promise. The country office, a very strong country office in Ukraine. Deputy Minister Gonchar, the country office in Ukraine is the only office of the 33 where I did not cut the budget. We are pulling this off again through 3 tracks: restructuring within WHO, within the UN, and alignment with the partners. Let's start with within WHO. We're going from 5 technical divisions to only 3 technical divisions in line with the core mandate. First division, prevention and health promotion, led by Gundo Weiler. Actually, we were commended for this, right, Gundo, already yesterday by our beloved non-state actor to say, finally, WHO is going back to its bread and butter. Second division, health systems, led by Natasha Azapardi-Muscat, which incorporates, I also want to kill some fake news here, which incorporates the sexual reproductive health and right, which remain a critical area. To be very bluntly speaking, in all modesty, I don't think there has been any elected official in WHO who has been such a champion on sexual reproductive health and rights and an advocate for LGBTQI+ community than Hans Kluge. Third division, health security, ably led by Igor Perehinets, which keeps a strong AMR program. Primary healthcare, I decided, this is novelty too, I decided to make it a cross-cutting priority because I know, in the beginning of my career, I was a practicing family doctor in a fisher village in Belgium. It's the heartbeat of any health system. As the family doctor, I was the trusted person together with the mayor, because that's in my practice where mental health and trust was either gained or lost. We calculated with Melita Jakob, who is in charge of the Center of Excellence in Almaty, that in our region, mind you, there are 7 billion consultations by all primary healthcare workers together each year. 7 billion opportunities to create health and strengthen security. Can you imagine? Then we have 2 enabling divisions, but before that, I would like to commend you, Minister Dr. Alan Saranj, Minister of Health of Czech Republic, for walking the talk on primary healthcare, creating these prevention and promotion centers within primary healthcare facilities, and you link them with the civil society, walking the talk on social participation. Congratulations. First enabling division, program management, led by Corinne Capuano. I always say I couldn't dream of a better deputy, although Corinne doesn't want I tell this. I also tell this because I gave Corinne maybe the most important duty for the next years. It's with me to raise the scientific excellence of this office. I strongly believe, dear colleagues, that it is the European region which will have to remain the beacon of evidence-based medicine, including on immunization and including on fighting the fake news and restoring trust in science. That's why I decided, together with Dr. Sylvie Briand, the chief scientist of WHO headquarters, to launch a scientific advisory board in Q1 of 2026. And I would like to thank the Secretary General of the Ministry of Health of Belgium, Professor Dirk Ramakers. Thank you so much, Dirk, for your strong support in helping me to conceptualize and operationalize this scientific board. Thank you all. The second enabling division is business operations, led by David Allen, very ably led by David in Istanbul, leading on operational excellence and artificial intelligence. And tomorrow evening, please join us for a demonstration of what we are doing on the AI. In the middle, the core, the country support and the country offices, 33. With my directors at the head of offices, I review them one by one, listening again to the ministers of health. And there is it where we have to make this paradigm shift from reactive to anticipatory and drastically increasing the health diplomatic and listening skills of our staff. The European Observatory, Dr. Ewout van Henneken, doing great job. WHO office in Brussels, led by Oksana Domenti. Remember, this office, very important office, is not only having a regional role, but also on behalf of Geneva, the global liaison role to the European Union, and also hosting our famous health diplomacy courses. And then the regional director office, you can hold me accountable that ultimately the vision in the GPW 14 and the EPW 2 gets implemented always based on the principle of equity. And I will do so with tenacity, but also agility. Because the biggest danger I see for WHO globally is what we call in modern management the agility gap. It means that the pace of change in the external business environment is much faster than the pace of change inside the organization. And I commit to you that for the next 4.5 years as your regional director, I will watch this agility gap very, very closely. And I'm very proud that you see in the yellow box there I established the special initiative of the regional director on combating violence against women and girls, which also as a father of 2 daughters bothers me a lot. Please join me in the call for action I will launch in the afternoon. I would like to thank very much Minister Monica Garcia from Spain for hosting a very important meeting. I really would appreciate all 53 countries to be present. 21 November in Madrid, Minister Monica Garcia is hosting the first meeting on the special initiative where we are going to launch the first ever flagship report with country-specific prevalence data on violence against women and girls with very concrete policy recommendations so that the European health systems will no longer meet the survivors with indifference, but with empathy. Muchas gracias. Dear colleagues, I would like to reassure you that Hans Kluge is never restructuring in isolation. Several of you may know that my peers volunteered me into the global working group on restructuring under Dr. Mike Ryan's leadership that time. Last week, when Dr. Tedros called me with Raúl Tomás about the fact that the Global Reassignment Committee is a bit stuck, I immediately volunteered to send one of my best people as the chair to get on track again. And we are in constant touch with our counterparts in headquarters to move as a one WHO. And I reassure Dr. Tedros that in my capacity as the dean now of the region directors, he can rely on me day and night to help my peers. And you heard the region director of Afro this morning in a very inspiring statement. This relation is so important to establish a transformational post-COVID partnership between the global north and the global south now. Let's go to the second track. Ladies and gentlemen, in November last year, I was so proud to stand exactly where I stand now to host the annual retreat of the 25 regional directors of all UN agencies active in Europe and Central Asia, and we co-created the EPW2. Then I created a spin-off of 5 UN agencies plus Senior Director of Gavi and Global Fund to operationalize concrete alignments. We are ready to serve as the laboratory of the future of global health in Europe and Central Asia. And maybe let's listen to what some of my colleagues themselves have to tell about this alignment.
The quadripartite has been implementing a large project in Central Asia that aims to improve the One Health approach. We must continue looking for similar opportunities to make the One Health a daily habit. And the key word is together.
A recent highlight of our collaboration is European One Health Coordination Mechanism, a model we created that turns one vision into joint action. Looking ahead, let us link human, animal, and environmental surveillance into a single, practical, One Health dashboard to detect risks earlier and to respond together more quickly, more effectively.
A prime example of our successful collaboration is how we provided policy support to member states to integrate sexual and reproductive health and rights into universal coverage across Eastern Europe and Central Asia. Our partnership extends to other crucial areas, including cervical cancer prevention, maternal health, and healthy aging. Our shared goal is very clear: to accelerate health and well-being in the European region.
Together, we integrate normative gender and health standards into multi-sectoral response frameworks. Together, we build evidence and strengthen national capacities for the collection, analysis, and use of comparable violence against women prevalence data to inform progress and decision-making. Together, we have created tools for health workers, including the clinical handbook that helps them to support women who have experienced violence with care and compassion.
We live in unprecedented times. The challenges facing children and adolescents today are too complex for any single organization to solve alone. This is why the partnership between WHO Europe and UNICEF in Europe and Central Asia is key to ensure every child has access to the information and services they need to grow up healthy. Together, we can do more and go further than we ever could on our own.
I want to thank all my colleagues from the UN agencies and particularly those who are present with us today. I feel very, very fortunate. Thank you. And the final track, the third track under restructuring and alignment is the alignment with the partners outside of the UN. And here, first and foremost, I would like to express appreciation to Dr. Pamela Rendi-Wagner, and thank you, Pamela, for joining us, who came with her full senior team for 2 days to sit in the room here with my full senior team to work out, not theoretically, but very concrete, a joint plan of action. And one of the outcomes is to have, for example, joint annual reports on AMR, taking turns in leadership, integrating data from 3 platforms, WHO Glass, EARSnet, and CSAR. Thank you very much, Pamela. And maybe again, let's listen to some of the partners outside of the UN on the alignment.
In a context of disruptions and tight budgets, OECD and WHO Europe recently renewed their commitment to collaborate. We will continue to ease countries' burden through joint health data collections. And we are keen to work together to our respective strengths to help countries improve health labor markets, so as to drive better patients and health workers' outcomes.
Dear Hans, thanks to your leadership, we have now momentum for action. This year, 2025, has been a year of firsts. Member states agreed at the World Health Assembly to the first ever resolution on integrated lung health, covering diseases from lung cancer to tuberculosis. Together, we launched the first ever WHO ERS regional report on chronic respiratory diseases in June in Dublin. And lastly, at this year's UN General Assembly, we ended up with a dedicated section on respiratory diseases in the UN Political Declaration. We will now redouble our efforts and reinforce you in all actions to implement all those three very important but very exciting milestones. Thank you so very much.
Thank you very much, Francesca. And please thank also Mark Pearson, who also especially came with you here to the team, and Joanna. In quarter number 1, 2026, I'm convening the meeting with the 10 presidents of the 10 largest European medical associations and patient associations to work out similar alignments. They represent 100,000 of clinicians. So they will take care of the clinical NCD management with WHO guidelines, and then we can focus on the core mandate, which is about risk factors and prevention. This is the WHO restructured. Leaner, sharper, aligned. And this WHO restructuring ensures that we're becoming stronger, healthier, and trusted. Evidence-based, politically neutral, with 20% less of the resources, leaving no one behind. Dear colleagues, in conclusion, I'd like to summarize how we are reimagining and reshaping the WHO of the future. Number 1, back to the core mandate, meaning delivering what you ask of us. Number 2, efficient and accountable, meaning value for money, innovation, artificial intelligence. 3, restructured and aligned, meaning leaner, sharper, fit for tomorrow. Remember, it's not about blunt cutting. It's about the new business model. At the same time, we remain a workplace of choice. 59% of our staff are women. No any major WHO office in the world has so many nationalities as we have. 90. We are respectful and inclusive, empowering staff to thrive, lead, and innovate. The road ahead will be hard. It will require difficult decisions, openness for change, and genuine partnership. But with your support, the WHO Europe will deliver in times of peace and in times of crisis, within a financially sustainable structure, safeguarding the core functions. There is an African proverb which says, if you want to go fast, go alone. If you want to go far, go together. By now you know that we are working always dual track, meaning we always go together, moving fast to save lives and going far to leave no one behind. Thank you very much. Merci beaucoup. Danke schön. Spasiba вам большое.
It's okay? Yeah. Thank you very much, Dr. Kluge, for this most impressive presentation. Back to basics, different with less, through 5 key roles, and essentially leaving no one behind. I think on behalf of the delegations, I would like to express my gratitude for all that you and your teams are doing during these challenging times, and for the continued significant and valuable support that you and your team provide to the member states of the region to ensure that no one is left behind. This is indeed truly appreciated. We will shortly open the discussion and invite interventions from delegates. Allow me to explain how we will organize our discussions rounds during this session of the Regional Committee. The discussion will be organized in 3 rounds. First, member states, then UN agencies and international partners, and then non-state actors. Delegations have been asked in advance to indicate if they wish to take the floor. Many have registered on the pre-established speakers list already. They will be given the floor first. Participants can follow the order of speakers online on their smartphones, laptops through the app. This should help to ensure that delegates are ready when they are given the floor. Delegations that haven't had the opportunity to register on the pre-established speakers list are invited to raise their flag to indicate their wish to speak. May I remind delegates to speak at a reasonable pace for our interpreters. Delegations can also send full written statements to the Secretariat for posting on RC75 website. Since we have a tight schedule, thank you in advance for your and respect for the agreed speaking times. A countdown timer will assist us in our work. And I would like to remind delegates that group statements are up to 5 minutes in duration and country interventions are up to 3 minutes. Stick to the time, please. We will now start discussion with the pre-established list. I invite now our host country, Denmark, to take the floor. After Denmark, we switch to Israel for a statement on behalf of the Southeastern Europe Health Network. Denmark, you have the floor.
Chair, dear Regional Director, colleagues, I have the honor to deliver this statement on behalf of Albania, Austria, Belgium, Bulgaria, Croatia, Cyprus, Czech Republic, Denmark, Estonia, Finland, France, Germany, Greece, Ireland, Italy, Latvia, Lithuania, Luxembourg, Malta, Moldova, Montenegro, Netherlands, Poland, Portugal, Romania, Slovakia, Slovenia, Spain, Sweden, and Ukraine. This regional committee meeting marks the 75th anniversary of our cooperation in the WHO European region. We convene at a time of significant challenges to global health. The financial crisis affecting WHO on all levels is forcing us to look closely at our priorities and ways of working. We support the ongoing process of ensuring an effective and fit-for-purpose WHO as the cornerstone of the global health architecture, delivering on areas of comparative advantage on global level and in the European region. Therefore, it is time to focus on what is most important, as reflected in this year's theme, Back to Basic. It is crucial to protect the WHO's role in international health work in line with its constitution. Hence, it is essential to maintain the strong technical expertise within the regional office. In this spirit, we look forward to the adoption of the second European Programme of Work, which will guide our work and address the main public health challenges in our region. We ask WHO Euro to assess how to achieve the best division of tasks between Copenhagen and Geneva. It is crucial to avoid duplication and attain the highest possible level of complementarity. Reiterate our strong commitment to multilateralism and the WHO at all levels as reflected in our steadfast and sustained financial support as difficult decisions will have to be made. And let us also be clear that the successful work of the European Regional Office is first and foremost the responsibility of our region. Colleagues, unfortunately, we marked the 75th anniversary of our cooperation in the shadow of major man-made emergencies with an immense impact on human health. We commend WHO's efforts in maintaining and strengthening health systems under extremely challenging and often unsafe circumstances. We condemn all attacks on healthcare facilities and personnel. After more than 3 years, Russia's unjustified and illegal full-scale war of aggression against Ukraine continues to inflict a devastating toll on the Ukrainian people, on their lives, their well-being, their health. A comprehensive, just and lasting peace in Ukraine based on the principles of the UN Charter and international law remains a key priority. We remain committed to supporting WHO's efforts in Ukraine through financial and in-kind contributions, technical expertise, and diplomatic support. Between 2022 and 2025, the EU and its member states have allocated 4.2 billion in humanitarian assistance for civilians affected by the war in Ukraine. WHO has also been instrumental in supporting the people of Gaza suffering in the current crisis. We thank WHO in particular in its ever-committed team in OPT for their huge work. The EU will remain the largest provider of humanitarian aid for the occupied Palestinian territory, having mobilized 1.48 billion since 2023. We welcome the agreement reached on the first phase of the comprehensive plan to end the Gaza conflict. In the interest of alleviating the suffering of civilians in Gaza, we urge all parties to sustain a lasting ceasefire and unimpeded access and sustained distribution of humanitarian assistance at scale into and throughout Gaza. Medical assistance must be a crucial and substantial part of it, and medical evacuations to the West Bank, including East Jerusalem, must be resumed. We look forward to continuing a strong cooperation in the region for a healthier and more peaceful world. Thank you.
Thank you. We will now pass the floor to Israel and after to Italy. Israel, the floor is yours.
Your Excellencies, Director General, Regional Director, Honorable Ministers, ladies and gentlemen. It is a distinct honor to deliver this statement on behalf of the member states of the Southeastern Europe Health Network, SEAN, Albania, Bosnia-Herzegovina, Bulgaria, the State of Israel, Republic of Moldova, Montenegro, Republic of North Macedonia, Romania, and the Republic of Serbia, in support of the Second European Program for Work, 2026-2030. The State of Israel holds the presidency of the SEAN since July of this current year. SEAN welcomes the vision and ambition of EPW2, developed through an unprecedented consultation process, and strongly endorses its focus on the 4 megatrends of our time: health, security, climate change and health, non-communicable diseases and mental health, and aging well, as well as its 2 special initiatives on primary health care for the future and addressing violence against women and girls, all underpinned by digital innovation and artificial intelligence. We commend WHO Europe for leading a truly participatory process that reflects the diverse realities and aspirations of member states and for anchoring EPW2 in the theme Back to Basics. A reminder that resilient health systems and strong primary health care remain the foundation for health security, equity, and sustainable development. For the SEAN region, the EPW2 provides both a compass and catalyst to accelerated progress. Our countries continue to face complex challenges: pandemic preparedness led by the RHDC in Albania, demographic transitions addressed within the Healthy Aging Workshop in Montenegro in September 2025, workforce shortages discussed in Moldova in June of 2024, and rising NCD burdens deliberated in March in 2025 in Montenegro, but also share a deep commitment to solidarity and cooperation. Through the SEAN platform and Israeli presidency, SEAN member states are already translating these priorities into joint actions: strengthening emergency preparedness and response capabilities, expanding digital health transformation and data interoperability, investing in health workforce empowerment and skill development, and addressing the health and financing implications of aging populations. We also recognize the vital importance of mental health and well-being and reaffirm our readiness to contribute to the regional dialogue in reimagining care across the life course, including healthy aging and resilience building. Ladies and gentlemen, on behalf of the Southeastern Health Network, we reaffirm our strong support for EPW2 and its call for renewed solidarity in health. The scene member states stand ready to collaborate closely with WHO Europe partners and one another in transforming vision into action, building stronger, fairer, and more responsive health systems that deliver for every person in every community. We extend our sincere appreciation to Dr. Hans Kluge and the Regional Office for Europe for their continued partnership, leadership, and support to the scene region. We thank you for your attention.
Thanks to Israel for the statement on behalf of the Southeastern Europe Health Network. We now pass on to individual statements. Italy's first, and after that, Malta. Italy, the floor is yours. Micro.
Okay. Distinguished President, Regional Director, dear colleagues, Italy aligns itself with the statement delivered by Denmark, and we thank the Regional Director for his informative intervention and for the work carried out by WHO Europe in the present difficult convergence of financial constraint, shifting geopolitical dynamics and organizational change. While we address this year's theme, Back to Basics, Italy welcomes the measures undertaken to cope with the present challenges, including the strategic process that was undertaken since last January in the context of a reduced budget envelope. We take note of the effort to transform this difficult exercise into a recalibration of priorities that is both technically sound and politically informed. And in this context, we appreciate the frank dialogue we had with the regional office during the development of the new European Programme of Work. We particularly welcome the preparatory work towards the strategy Aging is Living, and are pleased that the GDO office that Italy hosts in Venice will have a key role in its future implementation. We also consider favorably the transition of the health and well-being economy technical area to a new GDO. We trust that WHO Europe will emerge from transformation as a more agile, integrated and results-focused organization, and that the review of working methods will lead to more targeted technical delivery and implementation, coupled with an anticipatory and policy advisory role for the organization. Finally, we look forward to learning the final results of the structuring plan by the end of 2025, as proposed. We remain available for a continued collaboration for a healthier European region. Thank you.
Thank you, Italy. Now Malta, and after that, Bulgaria.
Director General, Regional Director, colleagues. Malta aligns itself with the group statement delivered by Denmark. Today's global health challenges demand urgent strategic action to strengthen our response to existing challenges, preventing emerging threats, and prepare for the uncertainties ahead. Pursuing peace is not only a moral imperative, it is a strategic one that preserves lives and enables better resource allocation. Malta commends the World Health Organization for its leadership in global health. We value WHO's Euro's role in providing technical expertise and policy support, delivered with sensitivity to country-specific needs. As we navigate necessary reforms and reprioritization, we must ensure that the WHO's core mandate is preserved. We recognize the importance of WHO as a platform for meaningful networks, such as the Small Countries initiatives. We are committed to ensuring that this valuable role is sustained and supported going forward. We thank WHO Euro for advancing national strategies and frameworks in key areas including NCDs, mental health, aging, care quality, substance control, as well as joint workforce initiatives. Healthcare workers are the backbone of resilient systems. The findings of the WHO Euro-MEN study are a clear call for action. We must protect and support our care providers by acting on its recommendations. Malta acknowledges the progress in the European Programme of Work, including digital health. Technology and AI enhance healthcare and patients' rights, but also leads to challenges like vaccine and wellness misinformation, leading to detrimental effects on population health. While fact-checking helps, investing in digital health literacy, especially for children, is the most effective long-term solution. We are concerned about harmful advertising and social media's impact on youth. Protecting them is a public health imperative. We look forward to further discussion at the AI and Digital Health Conference in Malta this November. We are committed to continue to work together by evidence, equity, empathy, to build resilient health systems that protect the most vulnerable, empower future generations, and uphold the values of solidarity and peace at the heart of public health. We look ahead to collaborating further using evidence, equity, and empathy to strengthen health systems, protect vulnerable populations, support future generations, and promote solidarity and peace in public health. Thank you.
Thank you, Marta. We now pass on to Bulgaria. The Minister will read his statement in Bulgarian, and it will be translated from English. After that, it will be the turn on Estonia. Bulgaria, you have the floor.
Honorable Chair, Regional Director, Excellencies, Bulgaria aligns itself with the EU statement delivered by Denmark. Last month, when opening the general debate of the 80th session of the General Assembly, UN Secretary-General Antonio Guterres warned that the world has entered an age of reckless disruption and relentless human suffering. And he challenged world leaders to choose a future, a world of raw power or a world of laws. A world that is a scramble for self-interest, or a world where nations come together. The Regional Committee meeting marks the 75th anniversary of health cooperation in the WHO European region. Due to geopolitical developments, however, health today faces immense challenges globally, and health services are often disrupted or even barely exist. It is inconceivable that this is happening in a world advancing with shocking speed towards an AI era, and that there are still people without or with limited access to essential healthcare. That is why this year's theme, Back to Basics, is so pertinent and relevant. Bulgaria supports the ongoing process in WHO towards reform, restructuring and prioritization to ensure an effective WHO tailored to the health needs of its member states. Over the years, ever since WHO was established in 1948, Bulgaria has been a reliable partner, contributing resources, expertise, and ideas to the work of the organization at all three levels. We stand ready to continue this collaboration and truly hope that transforming the organization will be done with all necessary impact analyses and wise choices made, so that the WHO we see in the future is operational and fit for purpose to address the main public health challenges in our region. The Bulgarian delegation looks forward to fruitful debates on the health agenda items. Thank you.
Many thanks to Bulgaria. We now pass on to Estonia, after which it will be the turn on Slovakia.
Honorable Chair, distinguished Director General and Regional Director, Excellencies. Estonia aligns itself with the statement delivered by Danish Presidency. The WHO European region stands at the crossroads. We face interconnected challenges, from climate change and demographic shifts to consequences of conflicts in Europe, Middle East and beyond. Overlapping crises have made progress toward the health-related sustainable development goals increasingly difficult. And Estonia commends the regional office for its continued efforts under the European Programme of Work. We recognize the resilience and unity shown by most member states. Well, we heard Russian delegate to complain that you have no access to Europe. I'm sure all European leaders welcome all Russians after you have ended the brutal war in Ukraine and paid back all the damage done. We saw here videos shown by Dr. Kluge about Roman and Sasha in Ukraine, and the effects of this brutality has caused on those children who are innocent. Russia's ongoing brutal war in Europe causes devastating health and well-being conditions. It costs far too many lives. Russia bombs hospitals, schools and kindergartens in Ukraine. It deserves the firmest response, holding responsible those who are behind these atrocious war crimes. This unprovoked and illegal war of aggression makes it clear that Russia should not hold a role in shaping global health policy. As our region faces the consequences of aggression and instability, it's vital to strengthen health systems to be more resilient and sustainable. Even as one member of our region continues to have a severe and damaging impact on our collective mental health, we recommend the WHO's focus on this health issue. In the face of such challenges, building sustainable and accessible mental health systems becomes even more vital. This requires a stepped care approach that enables early interventions and community-level support. True leadership means acting on evidence and shared values. By working together, we can ensure health, well-being, and a better future for all countries in our region. Thank you.
Thanks to many thanks to Estonia. We now pass on to Slovakia. Sorry, after which it will be United Kingdom.
Thank you very much, distinguished region director, chair, excellencies, ladies and gentlemen. Slovakia fully aligns with the statement delivered by Denmark. It is my pleasure to speak today on the state of health in the WHO European region and the strategic actions towards the European Programme of Work 2025 and the 2030 agenda. This discussion offers a chance to review progress and highlight where renewed efforts are needed to build equitable, more resilient and prevention-focused health systems across the European region. At the current circumstances in the field of global health, an exceptional transformation is a must. The Slovak Republic expresses its support to the WHO in the ongoing reprioritization exercise. We are convinced that current financial limits will result in thorough, prudent and sensitive assessment of the organization's vertical and horizontal activities, and at the end will create a stronger and more agile organization with detailed focus on its core mandate. Slovakia strongly welcomes the continuation and further development of priorities established under the first European Programme of Work, particularly its role in setting a strategic framework that enables member states to systematically address major health challenges. We especially emphasize areas that have often received insufficient attention, such as NCDs, mental health, which have a profound impact on quality of life, social productivity and the sustainability of health systems, and therefore demand consistent support and concrete actions. Health is a cornerstone of social and economic development. Aligned with the second European Programme of Work, objectives, strategic investments in health are essential to improve the quality of life and bring significant social and economic benefits. Through targeted and coordinated resource allocation, we can build resilient, equitable and prevention-focused health systems which not only provide access to care, but also prevent disease, promote healthy lifestyles and reduce health inequalities. Therefore, we also welcome and endorse the strategy for child and adolescent health and well-being, which represents the key element of sustainability and readiness of future healthcare systems. The Ministry of Health of the Slovak Republic advocates for a comprehensive approach in prevention of NCDs, communicable diseases, and mental ill health, and stresses the growing need to strengthen intersectoral collaboration. Health objectives must be integrated across broader policies, development, education, social services, environmental protection, and urban planning, while not omitting the meaningful engagement of communities. Integrated efforts are essential to tackle the root causes of ill health and to support environments that enable informed and healthy choices. We'd also like to congratulate Regional Director Hans Kluge for his outstanding leadership and achievements, and we look forward to seeing the continued results of his dedicated work. As there remains much to be done, his commitment and focus will be key to advancing the priorities we jointly framed and pursued. In conclusion, the Slovak Republic reiterates that only through joint and coordinated efforts we can achieve the ambitious goals of the second European Programme of Work, 14th General Programme of Work, and the 2030 Agenda. Thank you very much.
Thank you. We now pass on to United Kingdom, after which we will take the intervention of the Turkey.
Thank you very much. Thanks very much, Dr. Kluge, for a great presentation as always. And we'd very much like to thank the WHO Euro staff, who we realise are going through a very difficult time at the moment and still doing a remarkable job. Thank you also for focusing on the 5 roles, which are clearly essential. Overall, we had one big message and then one smaller one, and the big one really is around prioritisation, as many others have said. It is absolutely essential that in Euro, we now differentiate between those things that are important for health, which we all know about, and those things that are important for health, which WHO Euro can actually make a difference on. And they are a subset of the first group. And we worry sometimes that we collectively encourage WHO Euro to try and spread itself thinly over many issues where actually Euro can make a relatively marginal difference and therefore has less time to spend on the things where it really can make a big difference. So some examples of just take 2 where WHO Euro is absolutely essential. One is on their work on surveillance and AMR and a variety of things around that, where only WHO Euro can do this. Another is your outstanding work in Ukraine. And we would absolutely agree with the comments made by Denmark on behalf of the EU, although we weren't part of those, on that, as well as other issues. But then I think we should be much clearer about where our differentiate, and this is where we have not, I think, been as clear as we should be as member states, between things that are essential, things that are useful for WHO Euro to do, and things that are essentially marginal. And through our discussions in the next 2 days, I would encourage people to differentiate between those 3. The second more minor point, but a very important one, is that we must not, as a result of this, as Europe, start to look in rather than look out, because we're prioritising. And very much welcome the fact that, Hans, you invited the regional director for AFRO, which is making so much of a difference, and the work that you and your colleagues have done in Gaza, which, although not in the Euro region, is something which we absolutely, as a global community, must now try to support now that it is possible to do so. But I'd go back to my central point, because it is the key point for this meeting, which is if we cannot do this differentiation between essential, useful and marginal, Euro is not going to be able to achieve anywhere near what it needs to over the next 2 or 3 years, given the financial constraints. Thank you.
Thanks to United Kingdom, we pass on to Turkey, after which Monaco will take the floor.
Okay. Thank you, Chair. Esteemed ministers, distinguished delegates. I would like to thank the Regional Director, Dr. Kluge, for the comprehensive report he presented and the Secretariat for hosting this meeting. First of all, I would like to stress the point raised by the Director General, different platforms regarding the global health situation, pandemic preparedness, equitable access to medical countermeasures, antimicrobial resistance, the health impacts of climate change, and the resilience of health systems are global health priorities that we must seriously address in the short term. WHO's leadership in ensuring global coordination is commendable. However, the scale of emerging threats make it necessary that the organization possess even stronger institutional agility, transparency in resource allocation, and the capacity to provide an accurate and effective response. Within this overall picture, our region holds a unique position within WHO as a pioneer. Therefore, our regional community, where we address regional priorities and their global implications, hold an unique place within global health. I believe that the upcoming EPW2 will provide a strong framework for achieving our regional goals and strengthening our global position. I would like to emphasize that during this period, not only the implementation of programs, but also the concrete implementation of the principles of strategic efficiency, financial resilience, and the accountability of high importance. As Turkey, we believe that all new and regional programs should focus on supporting innovation and production in the healthcare field, in addition to service delivery. As long as we make high technology accessible, we can say that we are paving the way for universal health coverage. The productive healthcare system model Turkey has initiated as a significant example in this regard, and we are ready to collaborate. Dear participants, while the European region has made significant gains in health, the period we are going through is being shaped by regional and global crises that strain our health systems. Today, we must draw attention to a deeper wound that touched not only our own region, but also the collective conscience for humanity, the humanitarian and health crisis in Gaza. In an environment where health facilities are targeted, ambulance access is blocked, and healthcare workers are losing their lives, we are becoming silent witnesses to the construction of a world where the right to health is being eliminated before our eyes. This situation is being normalized, pushing us to get used to it. I believe that we decision makers and decision-making mechanisms must step in precisely at these points. Our expectation from WHO and the international community is to assume responsibility for ensuring the opening of borders and the removal of all barriers. I wish you all a successful regional meeting. Thank you.
Thanks for Turkey, and I remember to stick to the time. Now the floor is for Monaco, and afterwards again for Israel, the individual statement of Israel. Thank you. The floor is to Monaco.
Merci, Madame la Présidente.
Thank you, Chair, Regional Director, dear Hans, Excellencies, colleagues, ladies and gentlemen. I would like to begin by warmly thanking the Danish authorities for their hospitality and their warm welcome. On behalf of the Principality, I am honoured to take part in this 75th Regional Committee with a clear call for us to go back to basics. This theme is very profound given that our organisation and the multilateral system is going through a period of uncertainty and redefining itself. We are going through a significant financial crisis, and Monaco welcomes the constancy and the clarity of the board and the regional committee, turning this into an opportunity to redefine priorities and to focus our efforts on what is the heart of WHO's mandate. In this return to the basics, Monaco fully supports our recentering on the core functions of the organizations, its normative and standard-setting role, and its focus on data, its coordination role, and the complementarity of health workers around the world, its support for national healthcare systems in order to ensure their longevity. Monaco, however, supports a return to essentials in the structural sense, with an improvement of managing human and financial resources, as well as the implementation of a budget system which is transparent predictable and sustainable. Under the 14th GPW, we welcome the direction that this has taken. We also welcome the European movement. We have a will to reform and a spirit of cooperation which are notable. We congratulate the regional director and his teams for their efforts in putting this transformation into place. Finally, coming back to basics, we call on all states to consider our national situation. We wish to further coordinate healthcare systems with broad vaccination systems and a focus on continual improvement of access to healthcare with a view for sustainable healthcare based on shared responsibility and transparency. We must recognize that health is a global right that means that our choices and the solidarity of our actions are essential. Monaco reasserts its faith in WHO and its commitment to efficient multilateralism, and we will continue to support a strong organization which is agile and true to its mandate. We also welcome the commitment of all member states in this area. Thank you very much.
Merci. À Monaco, the floor will be passed to Israel. Afterwards, we will try to establish the connection with New York. Israel, the floor is yours.
Director General, Your Excellencies, I'd like to start by saying that Israel supports Dr. Kluge's reform to streamline WHO Europe. We support real action on efficiency, transparency, accountability, and focus on WHO's core mission and political neutrality. We have recently marked 2 years to the October 7th massacre, where nearly 1,200 Israelis were brutally murdered in the largest mass murder event of Jews since the Holocaust. These 2 years have been the most challenging for the Israeli healthcare system. From treating on that horrific day more than 1,000 injured, flooded our 2 hospitals in the south, to the targeted Iranian missile attack on Soroka Hospital, which caused great damage, but due to preparedness and some luck, without major casualties. Sadly, we saw hospitals in Gaza used as terrorist command centers, as holding cells for Israeli hostages, and as rocket launch sites. Too many, unfortunately including some within WHO and WHO member states, ignored or failed to condemn this violation of medical neutrality and the use of health infrastructure as a shield for terrorist activities. In the face of such atrocities, we have set mental health as our top national health priority, and the national initiative is now being deployed. I'd like to thank Dr. Kluge and WHO Europe for supporting programs to strengthen the mental health and resilience of our medical teams and first responders. Dr. Kluge, I'd like to express my deep appreciation for your consistent solidarity, compassion, and your inspiring leadership. Health should be the bridge to connect people and nations, not an arena for politicization. In order to maintain professional focus and counter the crisis in public health, WHO should focus on its core mission. During these 2 years of war, the Israeli health system chose life. Israel medical teams, Muslims, Jews, Christians, Druze, and others have stood shoulder to shoulder to save lives under fire. That remains our message to the world. We stand ready to work with our partners to advance health for all and a safer, more peaceful future. Thank you.
Thank you, Israel. I think now we try to establish the connection with New York. Just as announced earlier today, we have the great pleasure to give the floor to Dr. Tedros Adhanom Ghebreyesus, WHO Director General, who will share with us key achievements and challenges in global health and WHO's work to respond to these. Dr. Tedros is connected live from New York. Good morning, dear DJ. Good morning, Dr. Tedros, and the floor is yours.
Good morning, Chair. Can you hear me?
Yes, thank you. Thank you, Big Brother. Yes.
Thank you. Our chair, Honorable Minister de Press, Honorable Ministers, Ambassadors, Heads of Delegation, Regional Director, Dr. Hans Kluge, my friend, dear colleagues and friends. Good morning from New York. I'm very sorry I can't be with you in person. And thank you for adjusting the program to enable me to join you virtually. As you know, the UN is at a critical juncture. And this week, the entire leadership of the United Nations is meeting here in New York to discuss the UNAIDS reforms, the humanitarian reset, the SDGs, and changes to the UN's efficiency, mandate, and structure. That's why I couldn't be with you and I had to be here, given the circumstances. I know you understand. WHO is giving our full support to this process because we're part of the UN family, but also because our success depends on the success of the whole United Nations. WHO is the only agency participating in each of the three clusters, focusing on the UN's humanitarian, development, and specialized agency work. I see great promise in this agenda for advancing health with a particular emphasis on leveraging WHO's regional and country offices in line with the proposals that the Secretary General presented to the General Assembly earlier this month. I thank Denmark for hosting WHO's regional office in Europe, and I thank all member states for the strong support you have shown for WHO in the past year, especially to Denmark. Tack ska du ha. I also thank our staff in the regional and country offices for your dedication and professionalism during what I know is a very difficult time. Despite the many challenges we face, you have continued to support our member states to implement the 13th and 14th General Program of Work and the European Program of Work. And despite the many challenges we face, there are many successes to celebrate, which the regional director has described in this annual report. In every single country, there are successes to celebrate and challenges to confront. On universal health coverage, it's encouraging to see countries taking steps to expand service coverage, financial protection, and access to medicines and immunization, while strengthening primary health care, the health workforce, and quality of care. On health emergencies, countries are strengthening their capacities while responding to emergencies, including the war in Ukraine and in evacuating sick and injured children from Gaza. On promoting health and well-being, there is renewed focus on communicable and non-communicable diseases, climate change, antimicrobial resistance, and more. And I very much appreciate the work of the regional office to make WHO more effective and efficient. Of course, you also face many challenges, some new, some stubbornly persistent, some common to all regions, some unique to yours. The steady march of antimicrobial resistance, suboptimal vaccination rates, increasing obesity and diabetes, the highest rate of alcohol use in the world, the slowest declining rates of tobacco use, and the lowest rate of breastfeeding, a projected shortage of 800,000 health workers, high rates of violence against women and girls, and more are some of the challenges the region faces. Of course, you cannot solve all these problems this week, But one crucial way of addressing them is by giving children the healthiest possible start to life. So I'm pleased that your agenda includes new strategy for child and adolescent health and well-being. Likewise, meeting the many challenges we face will require innovation in products, services, and policies. So I welcome the draft strategy on harnessing innovation for public health. And even as we focus on the health of children and adolescents, it's also essential that we address the health needs of older people. So I am pleased that at this meeting, you will discuss a new strategy on healthy aging to be developed and finalized next year. In addition, I commend to you the second European program of work, which builds on the past and complements GPW 14. Honorable Chair, honorable ministers, ambassadors, dear colleagues and friends, at this year's World Health Assembly, member states sent a very powerful message that a strong and empowered WHO is what they want. First, the approval of the next increase in assessed contributions was a major step towards WHO's financial stability and independence and to protecting it from future shocks as envisioned when we started the reform in 2017, the finance reform. I thank member states for the historic decision you made in 2022 to increase assessed contribution to 50% of the base budget. And for the first two installments you have approved in May 2023 and in May this year, 2025. We hope you will make the remaining three installments in 2027, 2029, 20 and 2031 and achieve the 50% target. This is a key part of our finance reform, which is a strategic solution to the systemic problems we face, which link to financing model we have. We cannot understate how significant this decision is, both in the current crisis and for the long-term future of the organization. The increase in assessed contributions has helped us to save a large number of positions and reduce the impact of the funding cuts we have faced this year. But it's also a long-term strategic solution that addresses one of the organization's key systemic problems, and will continue delivering benefits for the next DG and beyond, because when we crafted this, it was a relay, a long-term program that puts WHO on a strong footing. The second major decision at this year's assembly was the adoption of the WHO pandemic agreement. This was truly historic and demonstrated that in these divided times, countries can still come together and find shared solutions to shared problems. It's vital that member states conclude the negotiations to the pathogen access and benefit system, the PABS Annex, in time for next year's assembly, so the pandemic agreement can be completed, ratified, and enter into force as international law. We all know that WHO is facing significant challenges due to sudden cuts in funding. In light of these cuts, as you may remember, I submitted a significantly reduced budget for the 2026-2027 biennium to this year's World Health Assembly, which member states approved. Based on this revised budget, the Secretariat has been undertaking major process of prioritization, realignment, and restructuring at headquarters and in every region, including Europe. We began at the top, reducing the number of senior managers and directors at headquarters almost by half. Over the past few weeks and months, we have been through a painful process of saying goodbye to a large number of colleagues. We have done it in a careful, systematic way with fairness, transparency, and humanity principles at the center. So the process has been, by and large, a good process, and it delivered. But the people who left, these are people who have served the world in many ways, including under extreme pressure during the COVID-19 pandemic, and do not deserve to be treated this way. But we see this crisis as an opportunity to build a WHO that's more focused on its core mandate, more independent, and more able to deliver for member states and the people we all serve. When we started the transformation, that was also part of the objective, to avoid shocks like we're facing now, and also to ensure that WHO is independent by stabilizing its financial sources. We think we can even achieve more with less by maximizing our convening mandate. That means leveraging and expanding our network of 800 collaborating centers globally, almost 1/3 of which are in the European region, and building new networks of partners. There are great opportunities out there everywhere in the world. The key is to work through them. We shouldn't try to do it ourselves. We can convene and do it through others. That's why I said we can do more with less. We're opening our eyes. And we plan to hold our first global meeting of all collaborating centers in April next year at the WHO Academy in Lyon, France, to explore how we can make best use of this powerful network of leading institutions and even recruiting more. Honorable Chair, honorable ministers, dear colleagues and friends, despite the challenges we face, WHO is continuing to do what member states have mandated us to do. We're delivering humanitarian aid to Gaza, Sudan, Ukraine, and elsewhere. We have helped to stop the spread of Ebola in DRC. We're helping countries to deal with the impact of bilateral cuts to aid, to catch up on immunization, to take action on NCDs and mental health, to monitor and respond to antimicrobial resistance, and to eliminate neglected tropical diseases. We're supporting the rollout of malaria vaccines. We're helping to accelerate the development of new vaccines against tuberculosis, very promising one. And we're working on the availability and affordability of long-acting antiretrovirals for HIV prevention, which could be a game changer for the epidemic. I was very pleased yesterday to see that South Africa became the first regulator in Africa to register lenacapavir, and just the third globally after the FDA and EMA. The wide use of lenacapavir will be a game changer, and we will continue to push with you. But none of this is achieved by the Secretariat alone. It's achieved in close collaboration with partners and with you, our member states. That close collaboration and partnership is so much more important now. So I leave you with 3 requests. First, I urge all member states to engage actively in negotiations on the PABS Annex to the pandemic agreement and to conclude it in time for next year's World Health Assembly in May. Second, I thank those member states that have received patients from Gaza, and I ask you to accept more patients, just as I ask more countries to open your arms. There are still about 15,000 patients who need to be evacuated outside Gaza for treatment, including 4,000 children, and more than 700 have already died while awaiting medical evacuation. And third, I urge you to seize this opportunity to work with us to build a stronger, more empowered, and more independent WHO that's better able to serve all countries. I look forward to continuing to work with my colleagues in the regional office and with all member states as we work together to promote, provide, and protect health in Europe and everywhere. Tack ska du ha. Thank you very much.
Dear Dr. Tedros, thank you very much. We really appreciate you being live with us early in the morning at your place, at noon at our place. Thank you for your inspiring words of encouragement and hope, and for your leadership guiding us into the future. Now more than ever, the central role WHO plays in preserving and promoting global health in the WHO European region and across the globe is and remains essential. Thank you. Before closing, I will pass the chair on to Gabriel to give some short messages. We will meet again at the afternoon. Thank you.
Dear everybody, thanks for coming back after lunch. And please get seated, and then we can proceed, because there's a couple of more interventions that we want to go through before the next break, which is going to be a little bit later this afternoon. Let's start right away with the next country, and it's going to be Norway, followed by Switzerland. Then Norway, you have the floor.
Thank you, President, Regional Director, eminent ministers, dear colleagues. The multilateral system and WHO is more important than ever. And I want to thank the Director General, the Regional Director, and all staff members for your invaluable work. Norway recognizes the difficult situation WHO Euro is facing and appreciates the ongoing efforts to achieve sustainable financing, effective governance, and realistic prioritization. However, we know that this is just the beginning. The organization will need to continue to make difficult choices to enhance efficiency and avoid duplication at all levels of WHO, as well as with other global health organizations. The new European Programme of Work provides a real opportunity to clearly define and prioritize the most critical activities for the region, focusing on WHO's core normative and technical function. The right to health, including sexual and reproductive health and rights, must be a core principle that is upheld across the entire organization. We must also continue our efforts towards universal health coverage. Fellow member states, the world is facing a number of challenges. Health emergency prevention, preparedness, planning, and response must remain a key element of WHO's efforts. We need to work hard to finalize the negotiation of the pandemic access and benefit mechanism in order to complete the pandemic agreement and allow its entry into force. In Ukraine, Russia's illegal war of aggression continues to cause tremendous civilian suffering and damage to health facilities. And in this first phase of the Gaza peace deal, full and secure access for humanitarian personnel and emergency aid to Gaza must be ensured. Attacks on healthcare facilities and health and care workers anywhere are completely unacceptable and must stop. Amidst these challenges, we must continue to work multilaterally and support WHO in striving towards the highest standards of health for all. Thank you.
Thank you very much, Norway. Let's go swiftly to Switzerland, followed by Belgium. Switzerland. It's not working.
Voilà, ça marche.
Yes, it works. Thank you very much, President. We'd like to thank the General and the Regional Director for their briefings and for their commitment. Switzerland recognises the important work that's going on around realigning priorities. This is a difficult process, and it has a real impact on the organisation's staff. We sincerely thank the staff of the WHO for their commitment to building an organisation that is fit for the future. We also underscore the efforts of Mr. Kluge and Dr. Kluge and his team for encouraging dialogue between headquarters and the Europe region. Regional Director, your commitment for taking better advantage of synergies with the UN regional agencies and other regional partners should be an example for us at global level as well. The United Nations is going through the most serious financial crisis for decades. This should be seen not only as a challenge, but also as an opportunity for reform. This time, the transformation of the UN system with the UN 80 initiative should be successful, and the WHO's efforts in these reforms must be on the priority of the agenda for the next executive board. May I underscore in this regard that the good functioning of the governing bodies in an organisation directed by the member states remains crucial. This requires an effort from our region, but also from all regions. WHO should also concentrate on the areas where it can add value, its normative role, its ability to help with coordination, and its technical assistance to member states. Regular dialogue with other global health stakeholders and a mapping of the existing strategies are essential and will continue to be so in helping to avoid duplication of effort and optimizing use of resources. Geneva is the heart of global health governance, and it's the ideal place to maximize the synergies between different stakeholders. We encourage the WHO warmly to take better advantage of this situation, and Switzerland remains committed to supporting this dialogue. Finally, there are financial and human constraints, and they call on us to act. We need to prioritize flexible and predictable financing. We need to strengthen basic financing and quickly fill vacant posts to preserve the continuity and the institutional memory of the organisation. Furthermore, we think it is crucial that we maintain full staffing within the secretariats of the governing bodies to ensure that we have proper implementation of the decisions taken by member states. Switzerland will remain fully committed to this reform process where it is constructive and lasting. Thank you very much. I thank Switzerland.
Continue with Belgium, followed then by Azerbaijan. Belgium, you have the floor.
Thank you. Monsieur le Directeur Général.
Director General, President, Excellencies, colleagues. Belgium associates itself with the statement made by Denmark. The last year has been very difficult for this organisation and for its staff. There have been financial difficulties, there have been geopolitical tensions, and there have been other risks around public health and to multilateralism. Therefore, we must restate our tireless support for the WFO as the vanguard institution for global public health. We greatly need the WHO in helping to define the norms that we must follow around public health. WHO can uphold science when misinformation and fake news is spreading. The WHO allows us to keep health at the centre of our concerns even during crises. We therefore particularly hail the role played by the WHO in supporting civilians and the healthcare systems in Ukraine and in maintaining attention on the dramatic human situation in Gaza. We firmly call on all parties to respect the ceasefire that was recently agreed to open the path to a lasting peace in the region. We also call on Israel to guarantee complete and unimpeded access for humanitarian aid and medical assistance that the Gaza population needs. During this year, budgetary cuts have had an impact on the staff of the WHO. We express all of our support and our thanks to the teams from the regional office, as well as to the people who unfortunately are leaving the organisation. The excellence of your work is a tribute to this institution. We hope that this restructuring and the difficult choices that have been taken will allow the WHO to continue to achieve specific results in Europe in order to provide tangible assistance to upholding public health in the region. The priorities set in the new European General Work Programme are essential. In the recent months, my country has developed a new cooperation strategy with the WHO that we hope will be signed very soon, and the priorities are closely connected to those in the new plan. Excellencies, colleagues, Hans, science is under attack at the moment, and some rights have become taboo. Economic interests are held up against public health, and at such a time we greatly need the WHO. Please be assured of the support of our country and of the confidence that we place in WHO and in its leadership. Thank you very much.
Merci beaucoup.
I thank Belgium.
Continue with Azerbaijan, followed by Ireland.
Dear Dr. Kluge, Your Excellencies, distinguished guests, ladies and gentlemen. The Ministry of Health of the Republic of Azerbaijan highly appreciates the visionary initiatives of the WHO Regional Office for Europe, aimed at shaping the future of health, as well as the comprehensive support extended to member states in transforming their national health systems. Despite the occurrence of various health threats in recent years, including heat waves and sporadic outbreaks of infectious diseases, these risks have been effectively mitigated through the timely and coordinated preventive measures undertaken by the WHO Regional Office. At a time when the global demand for qualified health professionals is steadily increasing, the establishment of the World Health Organization's Lyon Academy serves as a timely and strategic initiative to enhance the training and development of the health workforce. The promotion of lifelong learning through innovative technologies and modern training methodologies makes a substantial contribution to strengthening national capacities and facilitating progress towards the achievement of countries' health goals. The year 2025 has been declared the year of constitution and sovereignty in the Republic of Azerbaijan. Under the wise leadership of the esteemed President of the Republic of Azerbaijan, His Excellency Mr. Ilham Aliyev, our country continues to pursue an independent and forward-looking policy in accordance with the new global realities. Pursuant to the Constitution of the Republic of Azerbaijan, every citizen is guaranteed the right to the protection of health and access to medical care. Dear esteemed audience, 3 core priorities identified in European Programme of Work are well aligned with the key directions of the national healthcare system of Azerbaijan. To ensure equitable access to quality medical services without imposing financial hardship, mandatory health insurance has been operational nationwide since April 2021. Multi-sectoral committee comprising representatives of various government agencies has been created to assess situations that could lead to public health emergencies, strengthen the country's capacity for early warning and response, and improve coordination decision-making. Promoting health and well-being among citizens has been identified as one of the key priorities within the socio-economic development strategy of the Republic of Azerbaijan. As life expectancy continues to increase, health must remain a priority throughout the entire life course. In this context, discussions addressing a wide range of factors influencing human health were held during the COP29 in Baku last November. Since 1st of May 2025, the electronic sick leave system has been fully implemented nationwide. It's planned to finalize the development of the medical digital twin system by the end of this year. The recent global health challenges underscore the importance of close collaboration in shaping the health systems of the future. Better emergency preparedness requires a resilient global health infrastructures. In conclusion, we encourage WHO as a global coordinating health authority to continue setting norms and standards aimed at safeguarding the health and well-being of the world's population. Thank you.
Thank you very much, Azerbaijan. The next one would be Ireland, followed by Spain. Ireland.
Honourable Chair, Director General, Regional Director, Excellencies, dear colleagues, Ireland aligns itself with the statement delivered by Denmark. This has been a challenging year for our global and regional health, for the WHO and for the multilateral community more broadly. We condemn Russia's war of aggression against Ukraine and are appalled at the recent escalation of large-scale aerial attacks on Ukrainian cities. We deplore the targeting of civilians and civilian infrastructure and reiterate our call to demonstrate a genuine commitment towards peace by halting its brutal attacks and agreeing to a ceasefire without conditions. We welcome the agreement on a ceasefire and hostage release deal in Gaza. This is a significant achievement and the first step on a road to peace. We warmly welcome the release of 20 Israeli hostages after 2 long years in captivity. Our focus must now be on preserving the ceasefire and flooding Gaza with desperately needed humanitarian aid. In support of the appeal by the Regional Director General and the Director General, Ireland last weekend welcomed the arrival of a group of children from Gaza, our 3rd medical evacuation to date, to address the health needs of people from Gaza. The withdrawal by the United States from the WHO earlier this year came at a time when we were already affected by geopolitical conflicts and infectious disease outbreaks, as well as climate-related disasters, increasing non-communicable diseases and demographic shifts. The changed global context impacted on the work of the WHO at a global, regional and country level. But the organisation has yet again demonstrated its ability to adapt to changing circumstances and respond to a crisis. As a member of the region's SCRC, I have seen firsthand the exemplary leadership of our regional director and the work of our colleagues in our regional office to effectively mitigate through reprioritisation and strategic realignment. We wish to thank the WHO and all its staff for their invaluable efforts in making this an organisation which can deliver for health for all, in spite of these challenges. I also want to thank our fellow member states for facing these challenges with solidarity, ensuring that they are met with a comprehensive and cohesive response. In these challenging times, we must come together to strengthen our ties, to remain conscious of our interdependence, and to strive for the collective health of our regional community. As our theme suggests, we must get back to basics. For Ireland, it is vital to protect the WHO's central roles with respect to its normative and standard-setting functions, its leading and convening role, and its vital role in the direction and coordination of international health work, including in emergency preparedness, prevention and response. We look forward to working together to deliver our new European programme of work. Thank you.
Thank you very much, Ireland. Let's move on to Spain, followed by Luxembourg. Spain, you have the floor.
Honourable Chair, Director General, colleagues, Spain aligns itself with a statement delivered by Denmark on behalf of a group of states. Today we have heard multiple references to the many crises affecting global health. This is not only a financial crisis, it is a challenge to multilateralism itself. To restore trust in international cooperation, we must reform governance, strengthen equity, and ensure that multilateral institutions truly belong to everyone, leaving no one behind. In this context, the fragmented global health ecosystem must evolve into a coherent and purposeful architecture, one that advances our shared goals. Spain believes that WHO, under the principle of one WHO, must stand at the center of this renewed architecture. We recognize how difficult this is, especially given the financial constraints that have forced painful cuts and hard decisions both in Geneva and Copenhagen. We extend our deepest appreciation to the WHO staff affected by these changes. The theme of this regional committee, Back to Basics, reminds us that the fundamentals must guide our collective purpose: universal health coverage, with primary health care, including mental health as its backbone, climate change and health, One Health, and antimicrobial resistance, migration and health, health promotion to combat non-communicable diseases, and emergency preparedness and response. These are shared priorities that must be addressed jointly by WHO Europe and WHO Global, with full coordination and no duplication. WHO's action must continue to rest on 2 non-negotiable principles: human rights and equity. Under these, Spain stands for gender equality, sexual and reproductive rights, and the fight against violence towards women and girls. Finally, I would like to express Spain's hope that the agreed ceasefire will become permanent in Gaza and to reiterate the commitment of the government of Spain to the reconstruction of the healthcare system in Gaza, always in collaboration with the WHO. Just yesterday, our health minister, Monica Garcia, flew from Amman, Jordan, to complete a new medical evacuation. Spain remains fully committed to global health, with the WHO at its heart, working for a fairer world where the right to health is truly universal.
Thank you very much, Spain. Let's move on to Luxembourg, followed by Georgia. Luxembourg, you have the floor.
Merci, Monsieur le Président.
Thank you very much, President. Regional Director, Ministers, colleagues. Luxembourg aligns itself with the statement made by Denmark. We're meeting at a watershed moment marked by the key reforms and long-term health crises, geopolitical situation that is making global health more difficult, and there is an urgent need for consistency in global health governance. We congratulate the WHO for the reforms that have been carried out since the beginning of this year. The cuts in personnel are non-negotiable, and we express our support to the organisation and to the staff for the difficult time they're going through. Making operations more efficient, outlining priority action areas, which have been outlined in close cooperation with member states, all of that is very commendable. The objective is making the organisation sustainable. The objective is not austerity. We have a spirit of back to basics that is guiding the committee in coordination with the European Work Programme. And we are calling for the implementation of this programme centred on the WHO's key mandate to avoid any dilution in its normative work and to ensure that we achieve specific fair results. President, flexible financing is the cornerstone of the WHO. The contributions made by member states in Europe have allowed us to provide for a rapid response and to build trust and stability. But there are still budgetary shortcomings. Resilience depends on predictability, and predictability requires investment. There is, however, hope. Regional initiatives such as One Health and prevention for violence and working on digital health and climate issues shows that what is possible if we work together. Sharing regional expertise, joint programming and pooling of resources are just some of the efficiency measures, but they're also an expression of solidarity. In this year of crisis, we need to be show more solidarity than greater before. We need to see this as a crossroads. Let us choose consistency rather than fragmentation, fairness rather than exclusion, and vision rather than inertia. Together, we can build a future where health is not just a service, but a shared value, a right, a global public good, and a means of achieving peace. This is also a necessity in countries at war, in particular in Ukraine, where a fair, lasting, holistic peace based on the principles of the UN Charter and international law remains an essential priority for Luxembourg. Furthermore, Luxembourg restates its full availability to contribute actively for the implementation of the global plan to end the conflict in Gaza. We hope that the commitments taken on the ceasefire will be consolidated in the weeks to come to guarantee swift, safe and unimpeded humanitarian access in close coordination with United Nations agencies and international NGOs, with strict respect of international humanitarian law. Thank you very much, President.
Luxembourg, let's give the floor to Georgia, followed by Cyprus.
Distinguished Chair, Regional Director, Excellencies, Ministers, distinguished delegates. First of all, I have honor to reiterate that Georgia supports the statement made by Denmark on behalf of European states. It is an honor to take the floor and to reaffirm Georgia's commitment to stronger health systems, universal health coverage, and the shared priorities of the European region. Since 2013, universal health coverage has expanded access nationwide. Over the past 3 years, we accelerated reforms to make UHC more equitable and sustainable. We introduced reference pricing and managed entry agreements for pharmaceuticals and removed annual ceilings on medicines for chronic diseases and cancer. We also transitioned inpatient financing to a DRG model, rewarding quality and efficiency rather than volume. These steps are improving financial protection for households. In January 2025, WHO certified Georgia malaria-free, proof that steady investment in surveillance, laboratories, and vector control pays off. Let me say that each and every success that we had in our country, it became possible on basis of very strong support and very splendid, let me say, cooperation with WHO. Let me first of all reaffirm our respect and importance, emphasize the importance of support and cooperation, especially with Professor Kluge. Thank you so much for this opportunity. Just recently, we additionally updated our policy on narcotic and psychoactive medicines, improving access for legitimate medical use while strengthening stewardship, prescription oversight, and digital monitoring to prevent misuse. This year, we launched a comprehensive PHC reform, strengthening the role of family physicians, expanding screening and management of non-communicable diseases, and investing in digital health platforms. This summer, we introduced age-adjusted capitation and result-based financing pilot for PHC, backed by an additional 120 million USD from the state budget over the next 4 years. It's quite big amount of money for Georgian state. Crucially, we are deploying telemedicine tools and building digital capacity in rural areas so services move closer to where people live. In April 2025, we established the National Central EMR system for outpatient providers to strengthen continuity of care, quality measurement, and transparency. Telemedicine scaled during COVID-19 now supports remote consultations and specialist advice, reducing avoidable referrals and travel. Health system reforms have been translated into practice through Georgia's close partnership with WHO, from policy, advice, and clinical standards to implementation support and monitoring. We deeply value this cooperation and are committed to continuing peer learning and experience sharing across the region. Georgia stands ready both to share lessons from PHC financing pilots, medicines access reforms, and malaria elimination, and to learn from member states on health promotion, prevention, and non-communicable disease management pathways. Thank you very much.
Thank you very much, Georgia. Let's move swiftly to Cyprus, followed by Kazakhstan. Cyprus, you have the floor.
Dear Chair, Regional Director, Excellencies, ladies and gentlemen. This year's committee convenes at a pivotal moment. We're living through an era marked by interconnected crises, from public health emergencies and armed conflict to climate-related disasters. In this challenging context, where diseases and disasters transcend borders, Cyprus reaffirms its steadfast commitment to regional solidarity. At the same time, the World Health Organization faces serious financial constraints. Moreover, we remain concerned about the global health architecture that is also under pressure, and firmly believe that the World Health Organization must continue to serve as the cornerstone of global health governance. To safeguard the organization's sustainability and effectiveness, we fully support the ongoing reform efforts aimed at strengthening WHO's capacity to fulfill its mandated responsibilities more efficiently. In this spirit, we wholeheartedly embrace this year's committee theme, Back to Basics, as it reflects the urgent need to prioritize actions and update WHO's governance principles to meet today's realities. We commend the inclusive and transparent process that led to the development of the second European Programme of Work, a genuine example of participatory governance. whose resources are invaluable yet under increasing pressure. Therefore, it is essential that they are allocated where they can deliver the greatest impacts on public health across our region. To achieve meaningful and sustainable results, our actions must remain focused, strategic, and results-oriented. We are confident that this program can effectively address the current and emerging health needs of the region through clear priorities and a well-structured framework, while remaining aligned with the organization's financial realities and ensuring impactful prioritization. Dear Regional Director, Excellencies, it is our firm conviction that the pursuit of our common objectives to strengthen public health systems, safeguard the right to health, and secure a healthier and more prosperous future for all can only be realized through genuine collaboration, unity, and solidarity. The Greek philosopher Aristotle wisely noted, "The whole is greater than the sum of its parts." Guided by this principle, the Republic of Cyprus reaffirms its readiness to work in close partnership with all member states of the region to address both present and emerging challenges in an increasingly interconnected world. Thank you.
Thank you very much, Cyprus. I'll give the word to Kazakhstan, followed by Andorra.
Thank you very much, Mr. Chair, and distinguished Regional Director, honorable delegates. On behalf of the government of the Republic of Kazakhstan, I'm honored to extend our warm greetings to all participants of the 75th session of the WHO Regional Committee for Europe and express our sincere appreciations for the continued support provided by the WHO Regional Office for Europe. Over the past year, Kazakhstan has continued to strengthen its healthcare system and advance towards achieving universal health coverage. We have placed primary health care, recognizing it as a foundation of a resilient system. Our efforts have focused on expanding preventive programs and screening initiatives, improving early detection of non-communicable diseases, and integrating mental health services and enhancing the role of nurses and multidisciplinary teams. We're also improving access to essential medicines and diagnostic services, upgrading quality and safety standards, and modernizing clinical protocols and accreditation systems. Immunization remains one of our top priorities. We have maintained stable national immunization coverage and strengthened the cold chain system. In maternal and child health, we have expanded programs for perinatal care and early childhood development. To strengthen infectious disease control, we have reinforced laboratory networks and surveillance systems and enhanced emergency preparedness through all hazards approach in line with the international health regulations. We continue to combat antimicrobial resistance and promote multisectoral collaboration through the One Health approach. Digital transformation is another key priority. The introduction of electronic medical records, telemedicine, and advanced data analytics has significantly improved the accessibility and continuity of care. Kazakhstan is also taking concrete steps to advance climate resilience in health facilities and reduce the environmental footprint of our health system. Intersectoral coordination is being strengthened to ensure effective responses to cross-border health threats. We support the adoption of the second European Programme of Work for 2630, Joint Action for Better Health. Its priorities are fully aligned with Kazakhstan's national health agenda. We look forward to continued close cooperation with the WHO Regional Office for Europe and member states of the region to ensure effective implementation of this program, sharing best practices and achieving tangible, measurable results together. Dear colleagues, Kazakhstan reaffirms its commitment to the initiative of our President Kassym-Jomart Tokayev to establish a global coalition on primary health care. We invite all member states to join this important effort. The coalition will serve as a platform for sharing experience, mobilizing political support, and attracting investments in prevention and control of non-communicable disease. Kazakhstan stands ready in the spirit of solidarity and partnership to share its experience and to learn from others as we work together to accelerate progress toward the Sustainable Development Goals and ensure health and well-being for all. Thank you.
Thank you very much, Kazakhstan. I'd like to give the floor to Andorra, followed by Lithuania. Andorra, the floor is yours.
Honorable Chair, Regional Director, Excellencies, distinguished delegates. Andorra aligns itself to the statement delivered by Denmark. Despite being a small country, Andorra faces the same challenges as the countries around us. That is why we look forward to adopt the second European Programme of Work. Mental health, tackling NCDs, climate change, or strengthening primary health care are also among our priorities. Focusing on aging, as WHO quotes, aging is living. Therefore, we have already begun to work on measures to ensure the sustainability of our health and social system, placing the individual at the center. We have implemented several measures to ensure the well-being and independence of our elderly people. As part of our commitment with prevention and innovation, which can and should go hand in hand, a pilot study to detect and prevent fragility in people over 64-years-old has been carried out using the WHO ICOP approach, adapted to the needs of our environment. From here, a population screening will be implemented to identify individuals with loss in intrinsic capacity, who could benefit from personalized referrals, physical activity programs, or community workshops to prevent deterioration, with the goal of progressing towards healthy and active aging. This initiative is one example of how research can be transformed into a concrete action to improve the quality of life of our citizens. Furthermore, since 2020, as part of the National Social and Healthcare Plan for Older People, we have been working to guarantee dignity, promote personal autonomy and decision-making capacity among older people, keeping them connected to their community and social network. We would like to express our sincere thanks to the Small Countries Initiative and to Dr. Hans Kluge. We really appreciate your support and guidance. We want also to express our firm and strong support for WHO Europe in these tough times. Together, we can build resilient and sustainable health system, compromise with leaving no one behind. Thank you very much.
Thank you very much, Andorra. Let's go to Lithuania, followed by Tajikistan.
Chair, distinguished regional director, colleagues, I have the honor to speak on behalf of the Republic of Lithuania. Lithuania fully aligns itself with the statement delivered by Denmark. This 75th session marks a milestone for cooperation in the whole European region. 75 years dedicated to advancing healthier, safer, and more resilient societies. Yet, we meet at a time of major global challenges, conflicts, humanitarian crises, and rising pressure on health systems. The theme, Back to Basics, reminds us what truly matters: protecting health as a human right, promoting solidarity, and ensuring the strong and effective WHO. However, we must not forget the importance and weight that innovation carries during these difficult times. Lithuania welcomes the publication Quick Buys for Prevention and Control of Non-Communicable Diseases, which identifies 25 proven interventions with measurable impact in under 5 years. Recent analysis showed that 60% of non-communicable disease deaths could be prevented through public health measures addressing tobacco, alcohol, unhealthy diets, and inactivity, and 40% through effective treatment. These are powerful reminders that prevention must remain our top priority. These findings support our view that strong prevention policies, including fiscal measures such as sugar tax, to promote healthier lifestyles, are key to reducing the NCD burden and saving lives. At the same time, investing in our health workforce is critical. Lithuania is strengthening workforce planning, education, and capacity building to ensure a skilled, resilient, and motivated health workforce. We also support the mental health in all policies initiative and efforts to integrate mental health into emergency preparedness and youth well-being strategies. We are committed to reducing stigma, improving access to services, and promoting collaboration across sectors. Finally, health cannot be separated from peace, security, and respect for international law. Lithuania condemns in the strongest terms Russia's war of aggression against Ukraine. We stand firmly with Ukraine and will continue to support its sovereignty and territorial integrity for as long as it takes. Together, let us continue to work for a healthier, more peaceful, and more resilient world. Thank you.
Thank you very much. Let's continue with our colleagues from Tajikistan, followed by Hungary.
Thank you, Chair, Regional Director, colleagues. On behalf of the Republic of Tajikistan, I would like to express my thanks for the report that was presented. You have demonstrated the progress that has been made in the areas where we need increased support in order to be able to continue to move forward for universal health coverage. We share the priority of the transformation of PHC, and the European Centre of WHO, which was held in Tajikistan last year, has provided a platform for the integration of vertical programs, also increasing treatment for children and young people through WHO with a first point of contact. We need to have a sustainable healthcare system and strengthen trust in the population. We are grateful for the strengthened vaccination programs against HIV, which is an important preventative measure. Tajikistan actively supports the initiative of Central Asia on tuberculosis. Under this framework, we are considering PHC and molecular diagnosis, allowing us to develop a system for reporting within civilian populations. A cardinal role is played by WHO to synchronize resources and data concerning access to medicines and treatment. We are strengthening our national regulator and considering the assessment of these medical centers. We are ensuring access to necessary medicines. Concerning antimicrobial resistance, we are also dealing with the digital transformation, which is a priority in registering patients and ensuring telemedicine for hard-to-reach regions. We are also putting into place analytical panels for the assessing these situations. We are also moving in the direction of ensuring PHC and having Central Asia free from TB, as well as ensuring sustainability within the healthcare staffing. And we aiming to have the best possible results for healthcare and for the well-being of our population. Thank you.
Thank you very much, Tajikistan. Let's give the floor to Hungary, followed by Austria.
Thank you, Chair. Distinguished Regional Director, dear colleagues, the 75th session of the Regional Committee for Europe is held under the timely and necessary theme, Back to Basics. This theme is not just a reflection of principles, it is a recognition of present realities. It reflects the urgent need to refocus in a time of rising demands, constrained resources, and the changing global and regional landscape. The WHO, like many of our health systems, faces significant financial and operational pressures. the reconstructing and reprioritization currently underway are not only strategic, they are essential. We commend the regional director and the regional office for confronting this challenge with transparency and purpose. It calls us back to what is fundamental, the health and well-being of all people. In Hungary, we believe a well-functioning, committee-based primary care is the core part of any health system. Hungary's national health strategy aims to improving population health and reducing health inequalities. It focuses on prevention, early detection, and strengthening primary care by promoting healthy lifestyles, expanding digital health, and improving the efficiency and accessibility of the health system. The strategy also prioritizes mental health, chronic disease management, integrated care, by putting emphasis on the quality of care. But let me be clear. No country can succeed alone. The pandemic taught us that. WHO Europe's role in facilitating collaboration between countries, supporting preparedness, and providing expert knowledge contributes to a more effective approach to emerging health emergencies. Let us use this moment to reaffirm our shared commitment to an efficient, focused, and empowered WHO that delivers real value, supporting national policies where it is most needed. It is therefore crucial to preserve the high level of technical expertise within the regional office and the strong presence and collaboration with member states. Hungary stands ready to work with all member states and the regional office to protect the integrity and sustainability of the WHO and to ensure that back to basics becomes not a retreat, but a new beginning. Thank you.
Thank you very much, Hungary. I would like to give the floor to Austria, followed by Bosnia and Herzegovina.
Thank you, Chair. Regional Director Kluge, Excellencies, colleagues, Austria aligns itself with the statement read by Denmark. It is clear for us that in times of increasing complex crises, which all have an impact on the health of people and the health systems, we need close cooperation at the international and the regional level. As a result, we support the ongoing reform and restructuring process and the prioritization process of the organization, maintaining the core functions of WHO. Its coordinating, standard setting, and normative role are more important than ever. The second European programme of work was set together in the light of the current challenges. It strengthens the leading role of WHO in global health coordination and contains a vision which is adapted to the current situation for the next 5 years. We particularly welcome the anchoring of health security in the second European Work Programme. We consider WHO as continuing to be a central stakeholder which strengthens health systems in the region through its technical expertise. We see synergies between WHO initiatives and existing EU strategies as having a great deal of potential in order to ensure broad and coordinated health emergency care and reaction under Agenda 2030. Another priority of the new programme of work concerns ageing in health, and we welcome this. We must identify health determinants with equal opportunities at the head of this. Healthy ageing is no coincidence, but the result of social opportunities which tend to be passed down the generations. Women in particular are affected by poverty in older age, and we know that economic inequalities can lead to health inequalities. Strong multilateralism as well as international cooperation will be central in the coming years in order to be able to overcome the greatest challenges in the area of health. For this reason, I would like to reconfirm our commitment for close regional cooperation with WHO. In conclusion, it's very important to me to thank our WHO colleagues, in particular the Regional Bureau, for their commitment and their courage for change, the excellent cooperation, and the clear statement that we want to leave no one behind. And I'd also like to thank for the good work we've had with you. Thank you.
Bosnia and Herzegovina, followed by Latvia.
Thank you for giving me the floor. Excellencies, Regional Director, dear Mr. Kluge, distinguished ministers, ladies and gentlemen. It is a great honor to address this regional committee on behalf of Bosnia and Herzegovina. Allow me to commend the Regional Director, Dr. Kluge, for his leadership and tireless efforts in advancing health and well-being across our European region. We recognize that both the organization and its member states are currently operating in a context of constrained global resources. Despite our collective efforts to increase assessed contributions, the overall pool of available funds continues to shrink. But this challenge also presents an opportunity for WHO to focus on its core mandate as the leading authority in global health and to strengthen its role from project implementation to high-level evidence-based policy, advice coordination and strategic guidance. Primary health care must remain the backbone of our systems, and it must be comprehensive, integrated, people-centered, and supported by innovation, including digitalization, artificial intelligence, data tracking and management, and aligned with Bosnia and Herzegovina's international obligations to WHO. In Bosnia and Herzegovina, new centers for health promotion and disease prevention are emerging, and they are designed to connect health systems with communities and to extend the reach of prevention and care to every citizen. Also, we take pride in turning recent public health challenges into opportunities for improvement. The measles outbreak, for example, has strengthened our immunization services and improved vaccination coverage across all our citizens. Bosnia and Herzegovina fully supports the second European Programme of Work as a results-oriented framework guiding our collective efforts to advance population health. We also welcome the new Western Balkan Roadmap as an important tool to strengthen sub-regional cooperation, solidarity, and exchange of best practices. Looking forward, Bosnia and Herzegovina remains committed to following the strategic framework of the WHO European region with the hope of integrating new trends and policies that serve the health and well-being of all our citizens. Together, let us remain united in our mission to build resilient, equitable, and innovative health systems that leave no one behind. Thank you.
Thank you very much, Bosnia and Herzegovina. Let's follow up with Latvia and then Poland.
Thank you, Chair. Dear Excellencies, Latvia also aligns itself with the statement of Denmark. On behalf of my minister, Dr. Hossam Sabomari, I would like to warmly congratulate us on the 75th anniversary of the Regional Committee. A special gratitude should be extended to the WHO Euro team and its leadership that has been constantly guiding WHO Euro through these very difficult times when resources are stretched. Yet, every challenge brings opportunity, and we see that WHO Euro team is already guiding through and turning difficulty into determination. Dear Regional Director, I thank you for your presentations, and I also welcome several WHO activities which took place in Latvia in 2025. They were highly anticipated from our side, most notably in the fields of mental health, primary health care, and digitalization. WHO expertise has been instrumental to learn from best practices, identify gaps that should be closed, and not least, to leverage change. Latvia's commitment and reliance on WHO, invaluable expertise on the wide range of health policies, remains unchanged. Dear all, the world, not least the Euro region, is witnessing an overall ideological backslide, various crises, most painfully unjustified warfare. In this regard, Latvia reiterates its never-ending support to the brave Ukraine, who is fighting the aggressor, Russian Federation. Latvia, alongside the vast majority of global community, calls on Russia to immediately cease all hostilities, including attacks on healthcare facilities and health workers. and to withdraw all its forces from Ukraine's internationally recognized borders. I'm indeed glad to note that WHO remains highly active within its mandate in Ukraine and also in Gaza, and has been granting continuous support. Last but not least, I warmly welcome the upcoming adoption of the new European program of work for the next 5 years. A lot of work has been put into this. Latvia thanks the organization for actively involving member states in drafting process, and is particularly glad to see that health security and emergency preparedness is among the top priorities. In current circumstances, it could be no other way. Thank you for your attention.
Thank you very much, Latvia. Let's follow this up with Poland and then Iceland. Poland, you have the floor.
Thank you, Chair. Distinguished Regional Director, Excellencies, colleagues. Poland aligns itself with the statement delivered by Denmark. At the outset, we wish to thank the Regional Director for his comprehensive report on the work of WHO Europe in 2024-25 and to express our appreciation for the transparent and inclusive process of preparing to the EPW. This process has ensured that the new framework truly reflects the shared priorities and aspirations of our region. The past year has again tested the resilience of our societies and health system. Through ongoing wars, humanitarian crisis, and growing mental health challenges, we commend WHO Europe for maintaining its focus on solidarity, science, and equity, even in times of division. Poland strongly condemns Russia's ongoing war of aggression against Ukraine, which continues to destroy lives and health. We protest against the recurrent attacks on health and humanitarian personnel and facilities which break international humanitarian law. We thank WHO Europe for its steadfast support to Ukraine's health system and for helping to ensure continuity of care. Poland remains concerned about the humanitarian situation in Gaza and encourages engaged parties to implement the recent ceasefire agreement and to ensure access to humanitarian and medical assistance to all who need it. Poland attaches great importance to mental health, which remains a cross-cutting challenge across our region. During our presidency of the EU Council, we made mental health, especially of the youth, a central theme of the European agenda, promoting prevention, early intervention, and support for young people in the digital era, but also those affected by war, displacement, and other crises. We will continue to advance this priority through close cooperation with WHO and member states. Polish commitment to the WHO emergency response is proven by our recent voluntary contribution to the Contingency Emergency Fund, as we view this work being the very heart of the organization's mandate. In parallel, we support WHO's work on digital transformation, information, and artificial intelligence, ensuring that these technologies serve patients safely, ethically, and inclusively. Poland continues to advance e-health solutions and digital public infrastructure, and we look forward to enhance regional collaboration on these issues. Finally, allow me to thank Dr. Hans Kluge for his tireless leadership and dedication. The Regional Director's report shows not only the scale of WHO Europe's work, but also its heart, reaching those most in need, rebuilding trust in science, and reminding us that public health is a shared responsibility. Poland stands ready to continue work with WHO Europe and all member states to ensure that EPW translates into a tangible progress for our citizens, for stronger, more resilient, and more human health system across our region. Thank you.
Thank you very much, Poland. Before we continue, I would like to ask, I'm thanking you that you're staying with us. You know, we have a lot of speakers and there's a lot more on the list. And I'm very happy that people are joining the conversation and coming up with statements. So I would like to propose that we take our break a little bit later, maybe at 4 o'clock. In that way, we can finish up all the member states, the UN agencies and the non-state actors. And then we can after the break, come back to EPW2. So if that's okay, I would like to give the floor to Iceland, followed by Ukraine. Iceland, you have the floor.
Honorable President and Regional Director, distinguished colleagues,
First, Director Kluge, allow me to express sincere appreciation for an insightful and inspiring address. As mentioned, our health systems face rising demand, workforce shortages, and growing financial constraints, now compounded by competition from national security and defense. Our systems are therefore not sustainable. We need transformation. We must respond by reorganizing, embracing innovation, and ensuring that every resource is used wisely. Equally, by strengthening public health, we can delay or reduce the need for care. I believe our most urgent responsibility is to help professionals, the public, and policymakers understand the gravity of the situation. After all, a sense of urgency is the greatest catalyst for change. The World Health Organization plays a central role in fostering dialogue and cooperation. It provides a unique platform for sharing expertise and reaffirming our shared commitment to health for all. It is right that we pause at times to remind ourselves of this common purpose. We recognize the internal changes WHO is undertaking with its solid plan to improve efficiency. Though demanding, these reforms bring renewed focus and purpose, qualities essential for maintaining trust, accountability, and impact in today's complex global landscape. As a nation of fewer than 400,000 people, Iceland would like to highlight the success of the Small Countries Initiative. More than a decade on, it remains a vital network for smaller states facing unique challenges. Finally, Iceland aligns with other member states in recognizing the wars and conflicts have devastating impacts on health. We underline that protecting health and human dignity must remain a core part of all humanitarian and peace-building efforts. Dr. Kluge, we deeply appreciate WHO leadership and commitment. You have our full support as we continue this important work together. Thank you. Tack.
Thank you very much, Iceland. The next one is Ukraine, followed by Armenia. Ukraine, you have the floor.
Dear Chair, colleagues, I would like to begin by expressing our honest gratitude to Dr. Tedros, Director General of the WHO, for his global leadership in advancing health and well-being worldwide, and for his personal attention and support to Ukraine. We also deeply appreciate the WHO Regional Office for Ukraine for its constant commitment to public health and for its support to Ukraine. The continuous work for WHO country office under very difficult conditions remain vital to our people. Across the European region, we face after effects of COVID-19, rising non-communicable disease, growing mental health needs, and the health impacts of climate change. These challenges differ across countries, but demand shared attention and action. For Ukraine, the situation is far more urgent because of the full-scale invasion by Russian Federation. This war of aggression has severely affected every part of life, including health. Since February 2022, more than 2,400 objects of medical infrastructure have been damaged or destroyed. Hundreds of civilian medical workers were killed or injured. Attacks on health continue. Recently, a strike on a medical facility in Sumy on 28 September caused numerous casualties, including among medical workers. An attack on the Institute of Cardiology killed a patient and a healthcare worker. Sadly, there are many such examples. Another grave issue is the unlawful transfer of Ukrainian children from occupied territories. Public reporting shows federal health bodies in Russia have organized so-called medical evacuation, mass checkups, and health camps in governmental sanatorium for children taken from these areas. More than 19,000 children have been abducted, with cases of forced separation from patients, deportations, illegal adoption and militarization documented by United Nations mechanisms. Beyond physical harm, the psychological toll on our children is severe. Many suffer post-traumatic stress, depression, and emotional distress due to displacement, loss, and exposure to violence. There are also documented cases of sexual violence by Russian military against Ukrainian children, leaving lasting physical and psychological scars. A hospital is not a target. A child is not a trophy. Under international law, those who enable such acts can be held responsible. Titles do not grant immunity. Justice is not optional and is condition for sustainable peace. We are deeply grateful to our partners, member states, institutions, and civil society for assistance that help us maintain services and rebuild. We call for stronger international coordination, protection of healthcare under the Geneva Convention, and equitable access to care for all. Health is impossible without peace, and peace is impossible without justice. We count on your solidarity, partnership, and commitment. Thank you.
Thank you very much, Ukraine. I would like to give the floor to Armenia, followed by Germany then. Armenia, you have the floor.
Thank you, Honorable Chair, Director Regional, colleagues. First of all, I would like to thank Dr. Kluge for his comprehensive presentation and to reaffirm support for all the reforms currently being undertaken within WHO Europe. The convergence of climate change, demographic shifts, conflicts, and economic uncertainty is reshaping the public health landscape. Yet, within these challenges lies a profound opportunity to position health and well-being at the heart of public policy, thereby directly contributing to economic growth, social development, and long-term sustainability. It is possible if we think creative, engage youth, build partnerships, increase efficiency in our work, and have a clear strategy. In this context, the European Programme of Work serves as our essential health compass. The priorities and approaches outlined in EPW are strategically tailored. In recent years, Armenia has achieved notable progress in strengthening its healthcare system and advancing its national response to all megatrends highlighted in EPW, with specific emphasis on health security, NCDs, mental health, and healthy aging. At the national level, Armenia continues to prioritize universal and equitable access to healthcare. We included the UHC reform project in 2026 state budget, marking a decisive step towards building a sustainable, inclusive, and rights-based health system that leaves no one behind. These focused interventions are already making an impact, improving survival, extending life expectancy, and enhancing quality of life for our patients. Yet, the burden of NCDs presents a challenge profoundly shaped by a wide variety of influences and risk factors, such as smoking, obesity, lack of physical activity. And WHO's technical support in combating these challenges is crucial. Furthermore, we are dedicated to integrate prevention-oriented healthy aging into our all health strategies. From the maternal and child health through adolescence and extending to mental health and long-term care. Dear colleagues, together, of course, with WHO's leadership and guidance, have an opportunity to shape resilient health systems, equitable access, and healthier, more cohesive societies. It's our obligation. Thank you very much.
Thank you very much, Armenia. I'd like to give the floor to Germany, followed by Greece. Germany, you have the floor.
Thank you very much, President. Director General, Regional Director, ladies and gentlemen. Germany also endorses the statement made by Denmark. There are complex and multiple crises, aging societies, mistrust in science and institutions, war in Europe and around the world. The European region is going through a time of unprecedented turbulence. There's a Russian war of aggression against Ukraine, which is also a fundamental crisis for European security. Germany stands shoulder to shoulder with Ukraine. Our decisions will set the tone for the long-term future and prosperity of our citizens in Europe. This year's World Health Summit in Berlin encouraged us to think about the world global architecture and to reconceive it. And from this, and from the current developments, there are three key priorities for WHO Europe. Firstly, we're facing financial shortages, and therefore inefficiencies need to be reduced. WHO Europe has to focus on work that has to be done at regional level in the European area and has to be coordinated as such. The comparative value of WHO Europe needs to be identified and also made better use of. This, in our view, is the standard setting that the organisation does, strengthening of health systems and also the question of securing European health, including the fight against antimicrobial resistance and also strengthening sexual and reproductive health and rights. Secondly, the financial, technical and normative shortcomings need to be addressed. Only a resilient, science-based, strategic organisation will be able to face the current and future challenges. Germany remains a reliable partner for the organisation, and that's because we know that investing in WHO Europe is synonymous with investing in a healthy future. I'm therefore very pleased to announce that this year Germany will give a further 10 million euros to WHO Europe this year. A quarter of this money will go directly to WHO Europe. We assume that this financing will help to maintain important functions in the areas that we've already mentioned, such as securing health, antimicrobial resistance, and sexual and reproductive health and rights. At the same time, no state can deal with these financial shortcomings alone. All the member states have an interest in appropriate financing for the organisation and therefore in the implementation of the key concerns of the region. That's why we need to support the organisation. This also leads me to our third priority. As Europeans, we have to take on responsibility for the safety and security of our own healthcare systems and for its ability to work in the future as well as that of our pharmaceutical and medical products. The shortcomings in the global architecture are something that we need to address. That's not just risks for Europe, but they also represent an opportunity for our strategic positioning. This positioning must take place quickly and in a well-coordinated way. I'll close with a promise. Germany remains a determined defender of multilateralism in Europe and the world. We are pleased to work together with our European neighbours in substantive fashion and to come up with an improved, effective, resilient global health architecture with a WHO for the future at its centre. Thank you very much.
Let's move swiftly to Greece, followed by Finland, please. Greece, you have the floor.
Honorable Chair, Regional Director Dr. Kluge, distinguished delegates, colleagues, ladies and gentlemen. Greece fully aligns with the statement delivered by the distinguished representative of Denmark. It's a great honor to take the floor on behalf of the government of Greece. Allow me first to thank Dr. Tedros and Dr. Kluge for their inspiring reports and for the unwavering leadership they continue to provide to our region. The past 5 years have tested every health system in Europe, but they have also driven unprecedented transformation. In Greece, this period has been one of renewal, resilience, and learning, grounded in the conviction that every citizen, wherever they live, deserves equitable access to quality care. Since 2020, Greece has undertaken one of the most extensive health system reforms in recent decades. We have expanded the network of personal doctors, strengthened primary healthcare units across the country, including in our islands and remote areas, and improved emergency preparedness. These reforms, supported by the European Recovery and Resilience Facility, have made our system more people-centered and more responsive. A major priority has been AI and digital health. With the support of WHO Europe, we have been building modern, integrated digital infrastructure, introduced electronic prescribing nationwide, and launched new telemedicine service that connects specialists with patients in remote communities. These innovations have not only increased access, but also transparency and trust. They are helping us to participate fully in the European health data space and are bringing tangible benefits to everyday clinical practice. Equally important has been our focus on the quality and safety of care. Greece was proudly to establish, together with the WHO Regional Office for Europe, the WHO Office for Quality of Care and Patient Safety in Athens. Through this partnership, we have developed our national strategy on quality of care and patient safety, trained hundreds of professionals, implemented practical tools to measure, monitor, and improve outcomes in hospitals and primary care. We are deeply grateful for this collaboration, which exemplifies how WHO's country presence can translate global standards into concrete, lasting improvements. Colleagues, Greece remains firmly committed to the principles of solidarity and cooperation that guide this regional committee. We actively support WHO initiatives on migrant and refugee health, on preparedness, and on the growing challenge posed by climate change and mental health. We know that no country can meet these challenges alone. The strength of a region lies in our shared purpose and mutual support. As we look to the future, we do so with confidence and humility. We recognize the challenges ahead, aging populations, the burden of chronic disease management, the ongoing need to build trust and equity in our systems. But we also see the immense progress we achieved through collective action. Within WHO continued partnership, Greece stands ready to contribute to a Europe where every person can live in health, dignity, and security. Thank you.
Thank you very much, Greece. I would like to remind the following speakers to please keep to the minutes, because we're already a bit short in time, because we had not foreseen that so many would take the word. I would like to give the floor to Finland, then followed by France, please.
Thank you, Chair. Regional Director, Your Excellencies, colleagues, Finland aligns itself with the statement delivered by Denmark. We commend the WHO European region for its swift and dedicated response to the serious budgetary adjustments this year. The process has put a tremendous strain on the entire staff. We highly appreciate the commitment to maintaining continuity of work. We reaffirm our strong support for WHO as the global leader in promoting the right to health for all. In the context of the UN's 80th anniversary, WHO's role is more vital than ever in advancing peace, dignity, and resilience through health. Like others before, Finland expresses deep concern over the humanitarian crisis in Ukraine and Gaza. We condemn attacks on health infrastructure and underscore that health must never be used as a weapon of war. Protection of civilians and health workers is paramount. Finland is a long-time champion of health in all policies. We recognize that a whole-of-government and whole-of-society approach to health has a foundational role in advancing sustainable development, societal resilience, and gender equality. We welcome the vision of the second European Programme of Work and emphasize the importance of continuing work on SRHR and on economics and health for all. Finland supports the strategies on child and adolescent health and healthy aging. These reflect a life course approach, strengthen equitable health systems, and protect persons in vulnerable situations. Finally, as the digital transformation accelerates, we welcome the strategy on innovation. It is essential that we address both the risks and opportunities of AI in health. Health system governance must keep pace with innovation. Thank you.
Thank you very much, Finland, and you didn't have to take that so literally to cut down on the time. But thank you for the minute we won. The next will be France, followed by the Netherlands, please.
Monsieur le Director General, Regional Director, colleagues. France aligns itself with the statement made on behalf of the European Union and hails the efforts of the WHO Regional Office for Europe. Dr. Kluge, dear Hans, you have all of our support, and I thank you for the force of your statement. We also echo the statement of the Danish presidency. There are health, humanitarian, environmental crises, and they do not recognise borders. On the contrary, they're inextricably linked and they're mutually reinforcing, which has tragic consequences for the health and welfare of our populations. They call on us to be vigilant, and France stresses its tireless support for Ukraine. For more than 3 years, it has faced up to the large-scale aggression launched by Russia. This aggression has been described by the WHO a number of times in its disastrous consequences, and it is a manifest violation of the United Nations Charter and international humanitarian law. The 13th of October last, a historic peace agreement was signed on Gaza. This opens an opportunity of a permanent ceasefire, the liberalisation of all of the hostages, and immediate and unimpeded humanitarian access, in particular in healthcare terms. These crises remind us of an essential reality. The effectiveness of the global response depends on solid, consistent and predictable international health architecture. The WHO should be the beating heart of this, able to play its role as leader in coordination with the other stakeholders in the multilateral system. Our region is going through a period of major change in environmental, digital, geopolitical, demographic and economic terms. Our healthcare systems have to adapt to those changes, despite the shortage of staff and the lethal impact of growing health disinformation. In this context, the organisation and the regional office should continue the prioritisation exercise that was bravely launched and strengthen consistency between the three levels. This should also continue to meet the demands of transparency and efficiency in close connection with Geneva headquarters and while respecting the normative mandate of the organisation. France welcomes the work that has been done and the adoption of the second European programme of work. 4 main priorities bring us together today, and they are at the heart of the implementation of the programme. The first of these priorities is accelerating universal and fair access to healthcare. The second is reinforcing prevention, preparation and response to health crises through the One Health approach, made all the more possible thanks to the adoption of the pandemic agreement and the amendments to the international health regulations. The third is making prevention a pillar in our policies, and finally supporting health human resources and ensuring we have qualified health professionals. In this sense, the WHO Academy that was begun in Lyon last December is a powerful driver in offering innovative and high quality training, allowing us to respond to the needs of professionals around the world. And I will close my speech, if I may, dear Hans, with a friendly message to the WHO staff. We thank you for the quality of your work and for your leadership and for your warm welcome here in Copenhagen. Thank you very much.
Merci beaucoup pour votre intervention.
Thank you very much for your statement.
The next one on the list would be the Netherlands, followed by Portugal. Netherlands, you have the floor.
I don't think, okay, thank you. Dear Chair, Regional Director, dear colleagues, the Netherlands also aligns itself with the statement made by Denmark. The Netherlands remains firmly committed to advancing global health in line with our global health strategy. We acknowledge and value the WHO's pivotal role as the coordinating authority in global health, providing direction through its normative, technical, monitoring and convening functions. In recent years, this coordinating and convening role within the global health ecosystem has only grown in importance. This year, the WHO Euro region stands at a crossroads. Substantial financial cuts have led us to redefine priorities focusing on what is essential. We would like to thank WHO Euro for its continuous commitment to combating antimicrobial resistance, promoting sexual and reproductive health and rights, and addressing the severe risks that the climate crisis poses to Europe's health, safety and security. Chair, we welcome the proactive approach taken by WHO Euro in its engagement with the UN agencies regarding UN80 and the discussions with other key global health actors in the region, thereby recognizing the important interlinkage between WHO Euro's prioritization and realignment process, the UN80 initiative, and global health architecture reforms. They require an integrated approach to maximize impact. We thank you, Dr. Hans Kluge, our Regional Director, for your commitment and leadership in these processes. And be assured the Netherlands remains a partner at your side. For it is we, the Member States, together with you, Hans, and everyone at WHO Euro, who need to stand ready in this evolving regional and global health landscape to face and meet the challenges that lie ahead. Back to basics with an essential new programme of work that guides us in our joint endeavour. The Netherlands would like to use this occasion to repeat the need for sustainable and flexible financing for WHO. The reprioritisation process has shown us that large proportions of earmarked funding are hampering our ability to reset priorities quickly. In closing, the Netherlands greatly appreciates the work of the Pan-European Commission on Climate Change and Health and looks forward to its call to action with concrete steps to tackle the climate crisis and protect and improve health. Here you will again find the Netherlands as your trusted and supportive partner. Thank you.
Thank you very much, the Netherlands. Let's give the floor swiftly to Portugal, followed by the Russian Federation.
Chair, Regional Director, Excellencies, dear colleagues, Portugal aligns itself with the statement delivered by Denmark. We thank the Regional Office for its leadership and for the clear account of progress and remaining challenges. Despite the circumstances of recent years, this office has achieved tangible results under the European Programme of Work, protecting people's health and supporting systems under unprecedented strain. As we look ahead, we must recognize where progress remains too slow and where WHO continues to make a difference. On this, health promotion and well-being require renewed urgency. Life course health programs too. In Portugal, we are strengthening prevention through integrated, people-centered services, ensuring that quality and continuity of care become the norm. Because resilience depends on trust, we are embedding risk communication and infodemic management in training and practice so that accurate, timely information becomes part of the system itself. Equity remains our compass. In cancer, we are reducing inequalities in prevention, early diagnosis, and access to treatment. Across the life course, we promote mental health, strengthen health literacy with a twitch of behavioral science, and protect people from digital harms. We also embrace the idea that aging is living, ensuring that everyone at every age can thrive. Good health starts long before entering a clinic. Portugal has made strong progress in restricting the marketing of unhealthy food to children, an effort recognized this year with the United Nations Interagency Task Force Award on Prevention and Control of NCDs. None of this, of course, is possible without people. And this year, we also bring the voice of our youth delegate, calling for faster action on health promotion, on well-being, and for innovative financing that puts people and the workforce at the center. Portugal welcomes the EPW2 focus on implementation and its core priorities. Let us deliver that people not only see the difference, but feel it in their lives. Thank you.
Thank you very much, Portugal. Please, the Russian Federation has the floor, followed by the Republic of Moldova.
Chair, colleagues, we would like to thank the Regional Director for the report that was presented. Today's discussion is being held under the theme Back to Basics, which calls on us to recall the principles which over 100 years ago formed the foundation for the national healthcare system laid by the famous scientist Nicolae Semashko. These principles were that it should be free and accessible. Our country has a national system of healthcare which accompanies patients throughout their entire lives, starting from childhood, where we ensure a healthy start to life. We accompany them through their working years and support them as they age. In order to maintain this accompaniment throughout lives, Russia has a 3-tiered healthcare system which allows patients to receive free medical aid both in regional and federal medical centres depending on the severity and difficulty of treatment. Giving children a healthy start in life allows us to radically reduce infant and childhood mortality. The infant mortality in Russia is 3.6 for every 1,000 lives births. We have put into place one of the most extensive neonatal screening systems in the world. There is also the possibility to have screening for reproductive health. Children, including those with rare diseases, receive all necessary treatment, including with gene therapeutic treatment, fetal and robot-assisted surgery. The unprecedented modernization of primary healthcare that has been carried out has seen 8 modernized medical centers open every day over the past 5 years in our country. Over the past 3 years, we have also focused on mental health with over 1,600 mental health practices opening. The Unified State Information System allows us to ensure seamless sharing of essential medical information. A large number of the data are analyzed using AI. One of the priorities remains developing our staffing potential. The state supports programs in favor of young doctors as well as those working in remote territories. The improvement of the Russian healthcare system has been noted abroad. Since 2021, over 21 million foreign citizens received medical aid in our countries. We consider that today, going back to basics should be based on the fundamental principles of the modern achievements of medical science and practice. Only by casting off everything that does not respond to the interests of public health, which does not fall under the mandate of the organization, as well as by refusing to unnecessarily politicize, can we not only go back to basics, but go forward to basics. Thank you.
Thank you very much, Russian Federation. Please, Republic of Moldova, you have the floor, followed by Slovenia.
Thank you, Chair. Distinguished Regional Director, dear delegates, on behalf of the Ministry of Health of the Republic of Moldova, I would like to commend the WHO Regional Office for Europe for its leadership and strong coordination role in guiding member states through health system transformation and reform across the region. We meet at a pivotal moment for health in Europe, amid growing non-communicable diseases, mental health challenges, and the continued impact of conflict and displacement. These realities remind us that health is not only a human right, but it is also a foundation for peace, security, and resilience. For Moldova, the first European program of work has been both a compass and a catalyst for reform. We have advanced towards a more resilient and equitable healthcare system through the National Health Strategy 2030. The fully operational stroke care network has already reduced treatment delays and improved outcomes. As well, with WHO support, we have strengthened emergency medical care, enhancing clinical skills, modernizing equipment, and building national expertise, now shared beyond our borders. Health financing remains a strategic priority. Moldova is committed to enhancing efficiency and transparency in spending and broadening financial protection to ensure that every euro invested in health translates into tangible benefits for people and communities. Digital transformation is driving system-wide improvements, including e-prescriptions, a national electronic vaccine registry, and enhanced data interoperability, guided by the new National Program for Digitalization and Innovation in Health. Throughout this period, solidarity has guided our action, including our continued provision of health services to refugees from Ukraine. We deeply value WHO technical and financial support in extending coverage and improving resource allocation within our national insurance system. As Moldova advances toward European Union accession, our partnership with WHO is becoming increasingly strategic. The health sector stands as a key driver of our European transformation, with reforms in public health, healthcare delivery, digitalization, and quality assurance directly contributing to Moldova's alignment with the European health frameworks. Dear participants, the Republic of Moldova deeply appreciates how the WHO continues to demonstrate remarkable efficiency and impact. Its agility in addressing emerging challenges and achieving meaningful results with limited resources, while ensuring that no country and no one is left behind. We remain firmly committed to working with WHO and member states to invest in people, institutions, and innovation, building a stronger, fairer, and healthier Europe for all. Thank you.
Thank you very much, Republic of Moldova. Let's continue with Slovenia, followed by Belarus.
Honorable Chair, Regional Director, distinguished delegates and colleagues. Slovenia aligns itself with the statement made by Denmark and reaffirms its strong commitment to multilateralism as the foundation of global health governance. We see WHO as an essential partner in advancing our shared vision of health for all, and will continue to stand firmly by the Regional Office for Europe in this mission. We are encouraged to see that our national priorities continue to closely align with the strategic focus of the regional office and the core values of European region. We place particular emphasis on social participation, climate change, preparedness and decarbonization of health system, and of course the health and care workforce, the backbone of resilient health systems. We are equally dedicated to advancing health literacy, combating antimicrobial resistance, addressing commercial determinants of our health, and strengthening primary health care and public health through integrated public health services with public health policies. We see that we share these priorities with many other member states and call for cooperation under the coordination of WHO Euro to address them. Slovenia also underscores the importance of sub-regional cooperation and networks, such as Southeastern European Health Network and the Small Countries Initiative. These platforms demonstrate the value of peer learning and collection action across our diverse region. We have demonstrated our full commitment to WHO Euro through concrete action by hosting the Small Countries Initiative meeting in Bled in this May. In September, we have organized together an UNGA side event on social participation in New York. We extend sincere thanks to the regional director for invaluable support in championing the agenda of social participation together with Her Excellency President of Slovenia and His Excellency the President of Kenya and former Prime Minister of Iceland. None of this would have been possible without the dedicated technical and administrative support of WHO staff. We deeply value having witnessed WHO at its best, acting as one cohesive organization with headquarters, regional offices, and country teams around the world, united in purpose and commitment. This spirit of collaboration and shared vision is what truly drives progress and strengthens our collective effort to advance the global health agenda. Slovenia will continue working alongside WHO Euro and all member states to ensure that our shared commitments are translated into meaningful change for the health and well-being of all people in our region. I thank you.
Thank you very much, Slovenia. Let's continue with Belarus and then followed by Kyrgyzstan.
Good afternoon, colleagues. The Ministry of Health of Belarus thanks the Regional Director for supporting the implementation of the European Programme of Work for up to 2025 in Belarus with the aim of achieving the Sustainable Development Goals in healthcare. Our joint work aims to achieve our main goals: guaranteeing human health, throughout a person's life. Achieving this goal requires pooling regional, national, global, community and intersectoral mechanisms. Belarus is open for dialogue and ready to exchange experiences in all priority areas of cooperation on healthcare. I wish all of us productive work, constructive discussions on the margins of the 75th session of the Regional Committee of the organisation. Thank you very much.
Thank you very much, Belarus. Let's come to, at least for now, our last member intervention. Kyrgyzstan, you have the floor.
Thank you. In Kyrgyzstan, active work is being carried out to integrate services for the prevention and the control of non-communicable diseases at the primary healthcare level. This area remains a key priority for the Ministry of Health and the strategic component of our collaboration with the World Health Organization. The main focus of improving the early detection and the control of hypertension and the diabetes. New simplified one-page clinical protocols have been introduced, emphasizing the role of nurses in delivering integrated NCD care. Nurses are being trained to assess cardiovascular risk and to provide brief interventions on tobacco cessation, alcohol reduction, healthy nutrition, and physical activity. Digitalization is another strong pillar of our work. The country is introducing electronic registration system, including for patients with hypertension and diabetes. This digital platform enables continuous monitoring of key indicators, evaluating of care quality, and the timely data-driven management decisions. In addition, digital analytical tools are being developed to track screening coverage, the proportion of patients with controlled blood pressure and the glucose, and the overall effectiveness of preventive interventions. We also fully support the new European program of work and align our national NCD strategy with its vision and the principles, focusing on equity, innovation, and a stronger partnership. One of our new goals is to strengthen collaboration with local self-governments, ensuring that municipalities take a more active role in health promotion, especially in creating healthy environments at the community level. At the same time, we are expanding intersectoral collaboration, engaging the ministries of education, sports, agriculture, and the economy to promote healthy diets and the physical activity. Joint initiatives include developing school-based nutrition programs, improving access to safe public spaces, and raising awareness about healthy lifestyle through coordinated communication campaigns. The Ministry of Economy has also taken first steps, hope not last, towards fiscal measures, slightly increasing taxes on alcohol products to reduce consumption and to generate resources for public health. We are also deepening our engagement with civil society and the patient organization. Their participation helps us to ensure people-centered, culturally appropriate, and truly responsive community needs. We need to fight jointly with the commercial determinants of health. Finally, I would like to express my sincere gratitude to Hans Kluge for his continuous support and the valuable contribution to the development of the national non-communicable disease strategy in Kyrgyzstan. His guidance has been instrumental in shaping our vision, strengthening collaboration, and moving our work forward. Thank you very much.
Thank you very much, Kyrgyzstan. I have no other member state on the list. If there are any other member state who would like to intervene, otherwise I would propose that we move on to the UN agencies and our international partners. There are 2 on my list, and I think we are at 4 o'clock then. Then we should take a break and then go for the non-state actors after the break, after we had our well-deserved coffee. If you agree with me, then I would like to give the floor to Mr. Klaus Beck, Deputy Regional Director of the United Nations Population Fund and Regional Office for Eastern Europe and Central Asia. Dr. Beck, you have the floor. I don't know, maybe we've seen.
Regional Director Dr. Hans Kluge, Excellencies. On behalf of UNFPA, the United Nations Sexual and Reproductive Health Agency, I want to express our sincere appreciation to WHO, and particularly to you, Hans, for the invitation and for the long-standing fruitful collaboration between our agencies. This region has been facing unprecedented challenges: the impacts of conflicts, the climate crisis, the lingering effects of the COVID-19 pandemic, and reduced investments and donor assistance. Yet, despite these headwinds, we've also seen significant progress. In particular, I would like to congratulate WHO Europe for its achievements towards the 3 pillars. 1, ensuring universal health coverage, 2, addressing health emergencies, and 3, improving the health and well-being of the population, some of this work in partnership with UNFPA. Our collaboration has been an example of effective UN partnership, accelerating the Sustainable Development Agenda with a particular focus on policy advocacy for reducing financial hardship and improving access to sexual and reproductive health services. The expansion of UHC to fully incorporate sexual and reproductive health and rights is more critical than ever, especially as donor assistance decreases in our region. This is a smart investment that reduces inequalities and saves lives. Regarding health emergencies, UNFPA joins the call to invest in public health before a crisis as a matter of urgency. Improving the health and well-being of the population is our joint agenda. We will continue our partnership in applying life course approaches to deliver people-centered, high-quality SRH services. To accelerate progress and deliver on the commitments of the European Programme of Work and other strategies being discussed, we call on member states and donors to invest smartly, cooperate with purpose, and innovate for impact. On behalf of UNFPA, I reiterate our commitment and readiness to continue our close collaboration with WHO and member states on key priorities such as sexual and reproductive health and rights, youth and adolescent health and well-being, digital health, health systems response to gender-based violence and sexual violence, and healthy aging. I thank you very much.
Thank you very much for your intervention. I would like swiftly give the floor to NDPHS for the next intervention, before we follow then with UNICEF and CEI.
Honorable Chair, dear Regional Director Hans Kluge, distinguished delegates, thank you for the opportunity to contribute to this discussion. Over the past years, the NDPHS has reinforced its role as sub-regional multilateral platform, uniting experts and civil society actors from various sectors with policymakers across Northern Europe, translating social innovation into practical solutions. It has also actively involved Ukraine in its work. Cross-sectoral engagement, co-creating, and evidence-informed approaches remain central to our mission, which aims to connecting minds for healthy lives through sharing, learning, and caring. Promoting good mental health remains one of our top priorities. We are leading efforts to enhance well-being at work, as well as develop an age-friendly workplace model in health and social care sectors, helping retain the workforce amid the challenges posed by aging population. Our recent initiatives deepen cooperation between culture and health, fostering mental health and well-being through stepped care, community-based, non-clinical approaches that enable our health systems to evolve from coping to co-creating solutions and from addressing deficits to fostering empowerment. These efforts are being consolidated within an EU-funded, strategically important operation, the Platform on Mental Health in the Baltic Sea region. This platform aims to turn the results of regional initiatives into practical insights for decision makers, supporting Lithuanians' visions for mental health in all policies during its chairship of the partnership. At the heart of our efforts lies the power of regional networking to strengthen public health diplomacy. These networks embody the spirit of solidarity and shared responsibility, building trust, aligning priorities, and turning dialogue into action. Finally, I would like to thank all our WHO colleagues for your outstanding work and look forward to building on our strong cooperation in years ahead. Thank you.
Thank you very much for your intervention. I would like to give the floor to UNICEF now.
Thank you. Thank you, Executive President, ministers and delegates, regional director and WHO colleagues, representatives of youth and non-state organizations. Hans, in his brilliant presentation, and several delegations already acknowledged the pressing challenges we face. A dramatic reduction in resources for social sectors, particularly health and development, exacerbated by shifting political priorities and increased allocation to other areas, including defense. Already strained health systems are now further challenged in reaching the most vulnerable, especially children. This is occurring as children vaccination rates decline, outbreaks of vaccine-preventable diseases re-emerge in our region, and child obesity rises, fueled by aggressive marketing of unhealthy foods. Suicide rates among adolescents are increasing, and mental health challenges are expanding rapidly among young people. The European Programme of Work 2025-2030 offers a bold and structured response. It places child and adolescent health at the heart of its vision for lifelong well-being, through its third pillar and cross-cutting initiatives such as primary health care reform, violence prevention, and digital transformation. A dedicated strategy, A Healthy Start for a Healthy Life, commits to equitable care for children and young people, tackling harmful commercial influence and closing data gaps. Both documents are being discussed during this very meeting, one this afternoon, the other on Thursday. Their proposed actions promise long-term results in health outcomes and system savings. We commend Ministries of Health for supporting the EPW2 and its child health strategy. And we encourage all of you to champion them, mobilizing leadership, securing financing, and fostering collaboration. Despite the current financial constraints, UNICEF has streamlined operations to continue supporting member states. Our partnership with WHO has grown stronger, yielding joint tools like the PHC Pocketbook for Children and Adolescent Health and other products. We remain committed to working with all of you to deliver essential services to children and adolescents, save lives, and allow children to reach their full potential for a better future. Thank you.
Thank you very much, UNICEF. I'd like to give the floor to CEI, and for other UN agencies or international partners that have not or would like to get the floor, please raise your name tag. CEI, the floor is yours.
Thank you very much. Honorable Ministers, dear Chair, distinguished delegates, I would like firstly to thank World Health Organization Europe for inviting the Central European Initiative to the 75th World Health Organization Regional Committee for Europe. The CEI, in its quality as a regional intergovernmental forum of 17 member states in Central, Eastern and Southeastern Europe, fosters European integration and promotes sustainable development through regional cooperation. The CEI operates in a flexible and demand-driven manner to promote cooperation at an institutional level through its governmental, parliamentary, economic and local dimension, as well as through strategic partnerships. The CEI firmly believes in the importance of this consolidated collaboration between our two organizations with the objective of ensuring universal access to the health services, since health is a fundamental human right. Under this guiding principle, the CEI is fully committed in applying a multilateral and multi-stakeholder approach to foster better health and well-being in its member states, supporting them in building stronger and resilient healthcare systems, improving the quality of the related services, enhance education, deployment and performance of the health workforce, and guaranteed access to the medicine with particular attention to the vulnerable population. Thanks to the mentioned approach, the CEI promotes, implements and supports projects, initiatives and specific actions in the cooperation with the numerous partners from our region in the field of health promotion and prevention, innovation-driven solution, mental health, healthy and active aging, improving access to the services and the general interest of the primary health care. This transnational cooperation and exchange provide us with a wide network of contacts, source of knowledge and evidence crucial in supporting our member countries in the shaping their own policies, strategies and platforms. This gathering will provide additional guidance, knowledge, and inspiration for future actions and synergies. Ladies and gentlemen, let me conclude by saying that the Central European Initiative will continue to be the dedicated partner of the World Health Organization in our common goal of ensuring better health and well-being for all. Thank you very much.
Thank you very much for your intervention. If there's no further intervention or anybody who would like to take the floor from UN agencies and international partners, I would suggest that we take a healthy break now, a well-deserved break. It was a tough negotiation with the office here in Copenhagen, but we negotiated half an hour break. So please be back at 4:30 sharp. Thank you very much. Thank you everybody for sticking with us and going to the last part of the first day here before we have the honor to go to the reception organized by our Danish colleagues. I think I would like to pick it up where we were before. We have some non-state actors that wanted to intervene, so I would like to go immediately to the first one, which would be the European Public Health Alliance, if they are available and in the room already. Yeah, perfect, thank you. We don't hear you yet.
Can you hear me now? Yes. Honorable Chair, dear Regional Director, esteemed delegates, colleagues, the European Public Health Alliance, on behalf of 18 non-state actors, warmly welcomes the second European Programme of Work and congratulates WHO Europe and its member states for co-creating such a forward-looking, inclusive and evidence-based framework. EPW2 comes at a time of profound transformation. Geopolitical instability, the climate emergency, demographic change, and the continuing burden of mental health conditions and non-communicable diseases are reshaping what health means and how we protect it. We welcome the clear compass values of security, solidarity, sustainability, and trust, guiding WHO Europe's vision that health must remain a universal commitment, never politicized, always prioritized. We commend the 5 strategic priorities of EPW2, building health security and preparedness, tackling NCDs and drivers of ill health, ensuring good physical and mental health across the life course, addressing the climate crisis as a health crisis, and shaping future health systems grounded in strong primary care, a skilled workforce, and digital innovation. We also welcome the special initiatives on violence against women and girls and primary health care for the future, both vital in achieving equity and inclusion. EPW2's focus on intersectoral action, social participation and innovation rightly recognizes that no single actor can address today's health challenges alone. Yet, WHO Europe's acknowledgement of severe funding constraints is sobering. Delivering on this vision will require new forms of partnership, trust and investment. We must ask ourselves, is equity still at the heart of our collective agenda? Do all people have equal access to care and the means to act on their own health? Are we ready for the pressures of climate change, aging, mental health crisis? The health sector cannot shoulder this alone. Civil society stands ready to help bridge systems and communities, translate science into action and build trust where it's most fragile. But to deliver on this role, civil society organizations across the European region need recognition, capacity building and structural support. We therefore call on WHO Europe to make collaboration with civil society a routine practice, from co-creation to implementation, and on member states to honor their commitment to social participation as set out in the WHO resolution by embedding civil society engagement in all levels of health governance. We remain committed to partnering with WHO Europe and member states to make EPW's promise a lived reality for healthier, fairer, and more resilient societies that leave no one behind. Thank you.
Thank you very much for your intervention. The next one would be the European Association for the Study of the Liver. You have the floor.
Distinguished colleagues,
representatives of the WHO Regional Office for Europe, representatives of states and non-state actors, ladies and gentlemen. On behalf of the European Association for the Study of the Liver, EASL, I'm honored to take the floor today to warmly welcome the recognition of liver health in WHO new European Programme of Work. For too long, liver diseases have been overlooked in public health policies, strategic planning, and implementation frameworks, even if scientific research has continued to grow. By embedding liver health in this new work plan, WHO Europe sends a strong message and much-needed signal that prevention, early detection, and treatment of liver conditions must become an integral part of our collective health agenda, bringing policy, practice, and science together. This milestone will help guide governments, health professionals, and researchers to work more effectively together for the benefit of millions of citizens. At the same time, we must recognize the broader picture. Metabolic diseases are on the rise, and their effects are deeply interlinked with liver health. Obesity, type 2 diabetes, cardiovascular disease, and liver health are all part of the same complex reality. Yet, liver health is still too often left out of these discussions, despite being central to understanding and addressing this growing public health challenge. A holistic approach, one that fully integrates the liver, is essential if we are to succeed. In this regard, we applaud WHO initiatives to establish a collaborative center for metabolic diseases at Imperial College London. We also welcome the creation of the European Health Alliance on Alcohol, now uniting 22 leading medical associations and representing nearly 2 million health and medical professionals. Founded by the European Commission through the EVOD Action Initiative, this alliance aims to transform scientific evidence into effective public health policies and actions across Europe. Alcohol remains higher in the European region than anywhere else in the world, contributing directly to 800,000 deaths each year, all of them entirely preventable. EASL is proud to have co-founded this alliance and remains firmly committed to contributing its expertise to ensure its continued success. Colleagues, the European region has a unique opportunity to lead the way in reducing the burden of liver disease, addressing the harmful effects of alcohol abuse, and advancing public health with evidence-based strategies. EASL stands ready.
Maybe come to an end?
Yes.
Thank you.
Thank you.
Sorry to interrupt you. Thank you very much for your understanding. And for the sake of time, I would like to ask the European ME Alliance to take the floor now.
Honorable Chair, esteemed delegates, the European ME Alliance represents people with myalgic encephalomyelitis, abbreviated ME and sometimes referred to as ME-CFS. ME is one of Europe's most urgent health crises. Millions suffer worldwide, and yet it remains largely invisible in global and national health policy. Imagine living with fatigue so severe that you cannot feed yourself, communicate, or leave your bed. Add disbelief, stigma, and dismissive medical care on top of that. This is the reality for patients, and our survey of over 11,000 people confirms it is systemic across Europe. ME patients urgently need support from healthy people to perform daily activities and administrative tasks in order to avoid overexertion and progression of their disease to more severe disability levels. Because when the disease and its disabling symptoms are denied, people are left without assistance and they become increasingly disabled until they are bedbound and unable to defend or care for themselves. Including ME is not just compassionate, it aligns with WHO's Europe's second program of work, It strengthens primary health care, addresses non-communicable diseases, and harnesses data-driven innovation to assure equitable access to care. ME is exactly the kind of chronic multi-system condition the EPW2 was designed to tackle through integrated, person-centered, community-based care. Inclusion of ME in WHO's global monitoring and surveillance system would fill the critical evidence gap for effective public health planning and patient protection. Applying WHO's health impact assessment methodology would identify structural barriers, gaps in access, training, and care, just as recent reviews have done for long COVID and chronic pain. Some countries are already leading. Switzerland is developing a national ME strategy. WHO Europe can help other countries follow suit, providing guidance and coordination to scale up best practices across the region. Thank you.
Thank you very much for your intervention. The next one would be your HealthNet, please.
Distinguished Regional Director, Chair and colleagues, on behalf of Your HealthNet, the European Partnership for Health Equity and Wellbeing, I thank you for the opportunity to address this session. We congratulate the Regional Office on the progress achieved under the European Programme of Work, which has provided valuable coordination and leadership across the region, particularly in difficult times of crisis. Regarding the state of health in Europe, we are particularly concerned about the persistent and widening inequalities in physical and mental health in most countries. Your HealthNet's recent study on social inequalities in health, using data from the European Social Survey, found that 1/3 of Europeans report poor health, and with those of low education, twice as likely to do so. Between countries, we see that countries are converging, but rather than an upward improvement for all, they are meeting in the middle, as health is stagnant or even declining in some Western European countries. What is driving these inequalities? We found the strongest associations with financial hardship, lack of control over one's life, poor housing, and unhealthy diets. And we call for greater cross-sectoral collaboration, which is essential to address these determinants. We need to invest in work beyond the healthcare sector, boost public health, and redesign our systems. We welcome the new EPW2 priorities, including investment in children and adolescents, promoting healthy aging, ensuring innovation benefits all. This is crucial to reducing health inequalities across the life course. And Your HealthNet remains committed to working with WHO Europe, with member states and partners to make health equity a measurable outcome of progress of EPW2. Thank you.
Thank you very much. Would like to pass the floor to Women in Global Health.
Thank you, Chair. Dear Regional Director Hans, distinguished delegates and colleagues, on behalf of Women in Global Health and our 8 co-signatories, we thank WHO Europe and member states for the opportunity to contribute to the co-created EPW2 and to welcome it as a vital roadmap for health in our region. We especially welcome the special initiative on violence against women and girls. At Women in Global Health, we believe that equity, solidarity, and human rights are the core principles that underpin better health for all, and there cannot be health equity without gender equity. Therefore, we urge to consider the following points on EPW2 priorities. Women make up 70% of the global health and care workforce, yet they remain underpaid, undervalued, and excluded from decision-making. They are the first responders in every crisis, but too often the last to be heard. We therefore call for a gender-responsive health emergency framework, urging member states to invest in women community health workers, include gender disaggregated data in preparedness plans, guarantee women's leadership in crisis response, and protect against gender-based violence in emergencies. This is not just about fairness, it's about building systems that work, and if women are holding up health systems, they must help lead them. The climate crisis also is not gender neutral. EPW2 must embed a gender lens across all climate and health strategies, ensuring that policies are informed by sex disaggregated data, community insights, and women leadership. in climate resilience and adaptation. Women are not only affected, they are also agents of change. Women are also often the caregivers for those living with NCDs, while also facing distinct risks related to cardiovascular disease, diabetes, cancer, respiratory diseases, and mental health, especially during pregnancy, menopause, and aging. While women's needs are under-researched, under-diagnosed, and under-treated, we urge Member States to adopt gender-specific strategies for NCD prevention, care, and mental health support, and to invest in women's leadership in NCD program design and delivery. As EPW2 champions digital transformation and AI in health, we must acknowledge the risks of embedding existing gender biases into new technologies. Algorithms are not neutral, and without intentional design, they can perpetuate discrimination. We call for greater representation of women and marginalized communities in AI development, governance, and implementation. We applaud emphasis on youth participation and strongly encourage all member states to include young women leaders in their delegations, not as tokens, but as equal partners in shaping health policy. In closing, EPW2 offers a transformative vision of the region, but at Women in Global Health, we stand ready to partner with you in advancing this vision. Let's move from rhetoric to reality, ensuring that women are not just the backbone of health systems, but also at the helm.
Thank you very much for your intervention, and please keep to the minutes that were allocated to you. Let's move now on to the European Respiratory Society. Is there no one there from the European Respiratory Society? Then I would maybe move on and ask the European Cancer Organization to take the floor, and then see if later on we can put the European Respiratory Society again on the floor. Yeah. Please, you have the floor. European Cancer Organization.
Thank you. Honorable Chair, esteemed delegates, dear colleagues, the European Cancer Organization and the undersigned organization, on behalf of the European Health Alliance on Alcohol, commend WHO Europe's leadership in addressing alcohol-related harm and welcome the implementation of the European Framework for Action on Alcohol 2022-2025. Despite the progress, alcohol continues to be a leading risk factor for ill health, preventable cancer, cardiovascular disease, and premature mortality. The WHO European region has the highest level of alcohol consumption globally. Alcohol is responsible for almost 1 in every 3 injury deaths in the region, 42% of all homicides, 37% of suicides, and 35% of road deaths. As recognized by the International Agency for Research on Cancer, alcohol is classified as group 1 carcinogen, causing cancers such as breast, colorectal, and liver. And the research is clear. There is no safe level of alcohol consumption. Even light to moderate alcohol consumption increase cancer risks. The societal and economic burden of alcohol-related harm is immense, straining health systems and widening inequalities in health outcomes. Yet, effective and cost-efficient intervention are now and available. The undersigned organization, therefore, are urging the Regional Committee to extend the European Framework for Action on Alcohol to 2030 to align with the WHO Global Action Plan, ensuring continuity and coherence commitment, prioritize alcohol policies within cancer, cardiovascular, and the non-communicable disease prevention agenda, explicitly acknowledging alcohol as a major preventable cause of non-communicable diseases in all strategic documents and public communication. Implement evidence-based measures recommended by WHO, including banning alcohol advertising, sponsorship and promotion, increasing taxation and minimum prices, reducing availability, and better health information and warning on nutrition labels. Strengthening monitoring and accountability with regular reporting on member states' progress and special attention to vulnerable population, usually most affected by alcohol-related harm. And mobilize whole of society engagement, ensuring the healthcare professional, the civil society, the patients' organizations are fully included in policy design and their implementation. We call on delegates to show strong support and effective leadership by committing a renewed ambition and united response to alcohol-related harm. And only through coordinated action we can reduce the preventable disease burden, tackle inequalities, and meet the targets for health and well-being. Thank you.
Thank you very much. I would like to give the floor now to the European Federation of Pharmaceutical Industries and Association, followed by the World Heart Federation.
Yeah. Thank you, Chair.
We would like to welcome the report by Dr. Kluge on the work of the regional office for the past year, navigating a challenging environment of escalating crisis and conflict, fiscal constraints, and geopolitical rifts impacting science, trade, security, and public health. Access to innovative medicines is one key area for European health systems that risks being negatively impacted by current developments. The trend of the last few decades, where the industrial base of the pharma industry and broader innovation ecosystem in Europe has been slowly eroding in favor of other more competitive regions, is now at risk of being greatly accelerated by trade measures and new pharmaceutical policies implemented in particular across the Atlantic. Without a strong European response, this could entail not only less investment in research, development, and manufacturing in Europe, but also slower or reduced access to innovation as a consequence of Europe losing its global position as an innovative region. Urgent and concerted policy action by governments, European institutions, and partners across the health ecosystem is needed to safeguard Europe's health security and resilience and innovation capacity for the future. In this context, we welcome that WHO Europe has continued the work on the Novel Medicines Platform as a forum where member states, payers, civil society, and industry can meet to discuss and co-create solutions. In particular, we welcome the setting up of a European Access Dialogue Platform as a permanent forum for in-depth dialogue on specific aspects on access to innovative medicines with all stakeholders. The European Federation of Pharmaceutical Industries and Associations, EFPIA, and its members are committed to continued collaboration with all parties in this platform, with WHO Europe as a neutral convener, with the objective of identifying and implementing win-win solutions that ensures both sustainable health systems and societies, a thriving biopharmaceutical sector, and most importantly, access to innovative medicines to patients across Europe. Thank you.
Thank you very much, FPA. I'd like to give the floor to the World Heart Federation, followed by Médecins Sans Frontières. You have the floor.
Honorable Chair, distinguished delegates, the World Heart Federation welcomed the prioritization of health security, climate change, non-communicable diseases, and healthy agents as core pillars of EPW. Nonetheless, NCD continues to be the leading cause of morbidity and mortality in Europe, accounting for 90% of deaths and 85% of years lived with disability. Cardiovascular disease, in particular, remains a major contributor to premature mortality, responsible for 3.9 million deaths annually across the region. World Heart Federation support the UN political declaration as a significant milestone. Yet, to truly shift the trajectory of cardiovascular disease, member states must go further and implement evidence-based, cost-effective interventions at scale, including treating 500 million more people globally with hypertension, achieving at least 50% hypertension control by 2030, raising taxes on sugar-sweetened beverages by at least 50% and on alcohol and tobacco products by at least 75% to reduce consumption, implementing the 2021 WHO air quality guidelines addressing systematic health inequities and establish a sustainable financing structure for cardiovascular disease management, and committing to a 50% reduction in NCD-related deaths and disabilities across all age groups by 2050. In the European region, the WHO Quick Buys, built on the WHO Best Buys, is a suite of proven, cost-effective intervention. The measures can deliver population-based benefits and measurable public health impact within 5 years. Finally, we call on member states to adopt and implement the forthcoming European Cardiovascular Health Action Plan, develop and prioritize a new strategy for NCD prevention and control under the EPW, and strengthen WHO Europe capacity to build and support member states in effective implementation. Thank you.
Thank you very much. The next one would be Médecins Sans Frontières, followed by Movendi. You have the floor.
Distinguished delegates, as we continue to witness the devastating impact of the war in Gaza, and despite the ceasefire, a population still deprived of essential services, inaction is not an option. We call on all states to maintain pressure to ensure the ceasefire is sustained and for the entry of massive influx of unrestricted humanitarian assistance, including medical equipment, medicines, food, water, fuel, and adequate shelter. But we also come with an urgent appeal here at this 75th Regional Committee to support the WHO's call on its member states to facilitate urgent medical evacuations of patients out of Gaza. 15,600 people are officially registered for medical evacuation by WHO. More than 3,000 of them are children. These patients require urgent evacuation for specialized treatment unavailable inside Gaza. Today, a patient with complex trauma-related injuries or life-threatening and chronic conditions such as cancer or kidney failure faces the same impossible reality as before the ceasefire. At the current pace, evacuation of the listed patient will take over a decade and people are dying. At least 740 people, including 137 children, have already died while waiting to be evacuated. This urgent appeal for medical evacuation has received limited response for some member states in this room. As a humanitarian medical organization working in Gaza, we've been limited in delivering urgent specialized care within Gaza. We call, therefore, to action. Maintain pressure to ensure the ceasefire is sustained and humanitarian aid can enter so we can do our work and save lives in Gaza. But initiate and scale up medical evacuations as well from Gaza and receive patients in EU member states and other WHO Europe member states, ensuring inclusion of gender and age groups and avoid narrowly prioritization of patients. Guaranteed patients' right to remain where they receive that dignified and specialized care and rehabilitation until safe and volunteer return is possible, securing, though, the right to return to Gaza. This regional committee member states have the means to act, and you can show solidarity and humanity. The right to health must be upheld for everyone, including those in Gaza. We thank you.
Thank you very much. The next one would be Movendi. Please, you have the floor.
Chair, Excellencies, we share the vision of a Europe where everyone can live a healthy, empowered life free from preventable harm. Towards this vision, the groundbreaking framework for action on alcohol has generated real progress since 2022. Across the region, public support for alcohol policy is high. More countries are taking action and the public discourse is becoming increasingly informed. This creates unique opportunities to fast-track progress and to ensure alcohol policy remains a clear priority across the new WHO Europe governance structure and themes. Advancing alcohol taxation is central to this effort. It prevents NCDs and mental ill health, reduces violence, alleviates pressure on health systems, and promotes the health and rights of children, youth, and older people. The unprecedented interference from the alcohol industry against independent science and public policy action requires renewed efforts to strengthen safeguards against conflicts of interest and for developing international instruments to protect health policy from undue influence and to address the cross-border nature of alcohol harm better. Finally, we call on the regional office and member states to pioneer mainstreaming mechanisms that build on social participation and link alcohol policy with broader social, environmental, and economic progress. These steps unlock opportunities to advance health, social justice, and sustainable development. Thank you.
Thank you very much for this intervention. We'll close this, and as we heard, there was a lot of comments, a lot of questions as well during all the interventions during the day. Oh, there's one more. Sorry. Yeah, please. You have the floor.
Good afternoon, dear Regional Director, dear Hans, esteemed chairs, distinguished delegates. On behalf of the co-signatories, EUFA, European Public Health Association, warmly welcome the new European Programme of Work, United Action for Better Health. It rightly places health at the heart of Europe's resilience as a foundation of peace, prosperity, and social cohesion. The experience of recent years has shown that resilient health systems are built above all on people, the skilled, dedicated professionals who form the public health and related workforce. from epidemiologists to educators, from data scientists to public health professionals and community health workers. They are the living infrastructure of preparedness and prevention. Their knowledge, integrity, and connection to communities are what sustains trust, our most valuable form of health capital. To turn this vision into action, we call for stronger investment in training, continuous learning, and representation of this workforce at all levels of governance. Public health must become a learning system, one that evolves through regular capacity building, exchange, and shared standards across the region. Continuous professional development should include not only technical skills, but also competencies in communication, ethics, leadership, and information literacy to address the growing infodemic and digital transformations. We also emphasize the importance of representation. Public health professionals and their associations must have a seat at the table where strategies are designed and resources decided. This participation ensures that workforce realities inform policy and that innovations are shaped by those who implement them on the ground. EUFA stands ready to work alongside WHO and member states to build inclusive, interconnected learning ecosystems, combining the excellence of academia, the reach of community networks, and the operational experience of practitioners. Together, we can secure a future where every country has a confident, competent, and supported public health workforce, one that is equipped to counter misinformation, adapt to new challenges, and protect the right to health for all. Health is not only an outcome, it's the pillar of resilience on which our common future depends. Let us invest in those who make that future possible, our public health workforce. Thank you.
Thank you very much. I understand that there's one or two more interventions, but unfortunately, for the sake of time and organization purposes, and you see all the lovely chairs here, things that we cannot do tomorrow, for example, we will have to proceed with this, so I would like to ask you to send us your written statement at this time point. And I'm really sorry that we couldn't give you the word and the floor to bring your statement forward. Because we need to move now, would like to give the floor to our Regional Director, Hans Kluge, to respond to the numerous questions and comments. And after that, we have some other points on the agenda. Thank you very much. The floor is yours, Hans.
Thank you, Dr. Denzer. Dear ministers, dear colleagues, I would like to thank all the member states, the partners and the non-state actors for very constructive interventions and what I feel unequivocal support. I'm deeply moved by the support expressed for our WHO European team. Many of you recognized the resilience of our staff in the face of financial strain and restructuring. Your words really mean a lot to them and to me. Thank you. You rightly acknowledge that we meet at a time of multiple crises: financial, geopolitical, humanitarian. Yet the purpose of WHO remains constant and arguably more important than ever before: to protect health as a universal human right. Countries spoke of shared priorities, strengthening primary healthcare as the foundation of universal health coverage, addressing non-communicable diseases and mental health, preparing for pandemics and antimicrobial resistance, and tackling the health effects of climate change, aging, and digital transformation. The message from across the region for me was consistent. WHO must remain the impartial coordinator for health, the guardian of science and solidarity, and the voice for those left behind. Health is not a privilege of peace, it is the path to peace. Now, on the first interconnected stream of work, core mandate, back to the basics. You called for WHO to stay close to its constitution, to focus on what only WHO can do: lead, coordinate, set standards, and serve every member state with impartiality. Came back time and again: prevention and promotion, and also the very consultative process that we followed to develop the EPW2. Across the region, we do see solidarity in action. Member states supporting Ukraine's health system, medical evacuations from Gaza, and shared expertise through the Southeastern European Health Network, the Small Countries Initiative, and the new sub-regional roadmaps for the Western Balkan and Central Asia. You also called loud and clear that health must never be a target. We stand with all people affected by conflict everywhere, where health workers risk their lives to save others. 3 weeks ago, for the first time, we had a UN convoy with one WHO staff member also attacked by a drone. Peace remains the most powerful public health intervention. On the second stream of work, to reimagine WHO euro of the future, efficiency and accountability, different with less. Many of you acknowledge the hard but necessary decisions taken to secure WHO's sustainability. And I thank you for recognizing the transparency of this process and for standing by our teams as they navigate change. The call for prioritization was unanimous. But one ambassador visiting me was telling Dr. Kluge, everyone talks about deprioritization. Please tell me, what are you stopping to do? What are you deprioritizing? 2 examples are, number 1, the NCD clinical management. And you saw the strong support from the European Respiratory Society. We're going to convene the other main European medical associations, and we're going to focus on prevention. Alcohol, tobacco, physical activity, diet, childhood obesity linked with the primary healthcare. The second area, for example, that we're deprioritizing is on hospitals. There are other very strong organizations doing this, and we shall focus on our bread and butter, primary healthcare. Innovation and artificial intelligence will be the essential tools for this transformation, and we will come back to this one. You also cautioned that cost containment must never come at the expense of transparency or fairness. Together, we will ensure WHO Europe remains a trusted and efficient partner that delivers measurable results for every euro entrusted to us. Sometimes I'm asking good friends in the member states, why are you giving such a huge, enormous amount of funding to Gavi, to Global Fund, and you're such a supporter of WHO? If you could give only a fraction of that contribution, we would be out of the financial gap. So we have to be very critical to ourselves and confront ourselves what I call the brutal facts of reality. Is there maybe a trust deficit? So the start is that we show measurable results for every euro entrusted to us. You know that I strongly believe in joint accountability, and that's why I would like to also ask you to help me, particularly those member states who are part of the executive board. WHO is one of the few organizations who still does not have a mobility policy. I myself am the example. I moved with my family every 5 years to some of the most difficult places on earth. I worked during the war in Liberia, Somalia, North Korea, 2 years in the prisons in Siberia with TB control, in beautiful Myanmar. So if you work with the WHO, why would it be a given that you remain for 15, 20, 25 years in the same spot? But my hands are tied. So in that sense, please help us to promote at a global level the mobility policy. Everyone will benefit from it. And then the third stream of work is on restructuring and alignment, one WHO. And thank you for recognizing that our restructuring is not just about downsizing. It's about redesigning WHO Europe for impact. And thank you also, there was one member state colleague mentioning that the globe to follow on our very constant close interactions with WHO headquarters. It's true, there's a lot of potential still over there. And you can count on me. Member States also welcomed closer alignment with UN agencies, the European Commission and the OECD, and further called for more synergy. But I really want to thank all those organizations present here, because we have been working very, very intensively. You recognized that the restructuring underway is not just an internal adjustment, but a cultural shift towards integration, agility, and collaboration. And I want to further assure you that we always work in full coherence with the 14th General Programme of Work. We're also aligning country presence with needs. Because this is uniqueness. No other region has this. We have 53 member states, the largest number. I'm very proud of this. I always say diversity is our richness. But we have country offices in half of the countries. In other regions, you have a country office in all countries. So this calls for a very careful balance between a strong normative powerhouse in Copenhagen, but still having strong country offices where the health inequities are largest in our region. The region is also modeling this approach through joint initiatives such as the Small Countries Initiative. And thank you for your call. This was very clear, but I'm very, very committed to the Small Countries Initiative, and I'm very happy to see that actually with the strong support of Minister Michalis Damianos, thank you, Minister from Cyprus, that the country office there will fulfill a very important secretariat function to the Small Countries Initiative, and also with the WHO Collaborating Center in Malta. Thank you as well. So this is a big, let's say, weight from my shoulders that we safeguarded that one. Several delegations reminded us that our voice must extend beyond Europe, which really pleased me. Supporting health and humanitarian action in Ukraine, but also in Gaza. Dr. Tedros always says, all WHO regional directors are part of the global WHO. We also have a global head. And also with the African region. My brother, you saw how inspiring he spoke, Dr. Janabi, the RD of the African region. I think this is very important, this post-COVID-19 transformative relationship between the global north and the global south, because there is still a little bit this feeling, let's be honest, about a little bit hoarding of the COVID-19 vaccines. So this is our chance to show that we are very, very serious, because this will strengthen global health, really. It's one WHO in action. Finally, closing, what I heard today was very clear. You want a WHO Europe that listens, that leads, and above all, that delivers, where we can add most value, doing efficiently, transparently, and in solidarity. So rest assured that we are reimagining WHO Europe to stay true to our mandate, focused on the people, driven by science and grounded in genuine partnership. Thank you.